Hello, everyone. Thank you for waiting and welcome to our second day of SciCon 2023. SciCon is the annual online conference sponsored by the ResearchHub Foundation. Yesterday, we had a great first day with two panels and 5 talks of covering several different topics. And so today we'll be following up with 2 more panels and 6 more talks. So let me just briefly go over the outline for today's. So yesterday, one theme that came up during our investing in DeSci panel is that there's this new concept of DAOs that can, gather fund, and that those funds can be invested into science to make more equitable and faster science. And so yesterday we didn't really have the time with so many things to talk about to get into the topic deeply. And so the first panel today will, address the problem. So we'll talk about BioDAOs, the BioDAO ecosystem spun up by molecules. So there's many different examples of BioDAOs, and we'll be getting into the details of each one of these. And then after that, we'll have our first talk of the day. Nicholas from LabDAO will tell us a bit more about what they're up to. They'll, he will show us what they are doing with Plex. And then after that, we'll have Omar from WeaveChain talking about distributed storage and what they're up to at WeaveChain. After that, we'll be talking about another topic that came out quite a lot yesterday, especially during our first panel with John Inglis and Loda Wallman, that is peer review. So Nassim will talk about what it is like to put peer reviews on chain. Then we'll have the second panel of the day that will be about AI in research. So AI is quite a hot topic right now, and we're going to be talking about how can you leverage AI in your research if you're a scientist. After that, we'll have Luca Foschini, the president of Sage Bionetworks, talking about open data, the concept of open data. So how can we openly share data and make those useful for other people that can then process the same data and draw their own conclusions. Then we're going to have Jessica Polka, executive director of Aza Bio. We'll talk about preprints and quality assessment, another real important topic that came up yesterday during one of our panels. We'll close the day with Eric Van Winkle from DeSci Labs, who'll talk about on-chain publishing and credentials. And then I'll close the day as I did yesterday. Also, something that I want to highlight is that today we'll have another guest. Will not really be a guest, will be moderating the talks with us. I'm really happy to say that we wanted to include the DeSci ecosystem into this event as well, and so we wanted to bring on board Jelani Clark from DeSci World, who will be moderating some of the talks that we'll have during the day. Again, showing how we need to have a cohesive ecosystem, bringing forward the ideas that we know that each of us, each project has. So without further ado, let me bring some of our moderators on. So Johnny, feel free to join the stage. Hi, Johnny.
Hi, Ricardo, and hello, everyone.
And then I should have Jeff as well. Hi, Jeff. I'll give you host privileges so that you can bring people on and off the panel. We do that now. Okay, you should be set. So you should be able to bring people on now.
Hi, Jeff.
Hey guys.
Hello.
Is that everybody?
Good to see you.
3, 4.
Good to see you.
Likewise. Yeah, great to see you.
Andrew, there's no other Andrew there?
There should be. I was just DMing with him. He should be hopping on shortly. Let me see.
No worries. As long as we've got one rep from you guys, that's
Cool.
that should be good.
Yeah, great. So once Andrew joins, I will give a little introduction about each of the speakers. And then we go into the questions. Glad to see you all here. Some of you I've seen at the beginning of the month in Berlin, I guess.
I thought I recognized you. Yeah.
Yeah.
By the way, I think Baxt is in the crowd now. Yeah, the other Andrew. Just if he yeah.
Could you bring him on, Jeff?
I will as soon as I see his name here.
Okay. Maybe then we could already start with introducing some of the speakers, but we still have 1 minute actually left until the really scheduled time, so let's not rush.
Cool.
Yeah, Johnny, maybe we can get started here, and then as I see other Andrew roll in, I'll bring him up.
Yeah, that's a really good idea. Yeah. All right, then I start on the bottom of my list actually, instead of the top where I had the two Andrews. Let me start by introducing Chris. I don't know how to pronounce it, but I think it's Burns. They say it like that.
That's right. Yeah, Burns, exactly right.
Yes. Okay, great. So yeah, let me pull up my notes to make this go as easy as possible. Yeah, here we have it. So Chris is the co-founder of BioDAO, and he is a legal advisor, IP legal advisor to Molecule. He studied philosophy and theology, which I find is not philosophy, law and theology, which I find is a very interesting combination. He worked then as an IP lawyer, and before he went into Molecule, where he's now inventing new forms of IP, creating IP NFTs and IP tokens. And today he's going to be talking about that, and at the same time representing BioDAO. So really happy to have you here, Chris.
Thanks so much. Definitely a flattering description of what we're trying to build with the legal primitives, but I think it's really exciting and super excited to chat as broadly about what I'm seeing in the ecosystem, and then specifically on BioDAO, which continues to be this very particular sort of work in progress. But I'm happy to talk about anything BioDAO specific as well.
Great. Then next on my list, I have Albert Anis. He's the co-founder of ValiDAO, synthetic biology DAO, which is focused on using synthetic biology to solve problems in health and climate and what else it can be applied to. He got an MA in biotechnology, so he has a background in synthetic biology. And he used to work at a competition called iGEM, where he helped student projects turn into startups. And he was doing a lot of this consulting. And now he's applying his expertise in ValiDAO, where he helps researchers turn their intellectual property into products. Yeah, very happy to have you here too, Albert.
Thank you, Jonathan. Yeah, like we focus. We don't actually focus at all on human health. We focus primarily on solving climate issues and food security. So in this way, we're slightly different from the other BioDAOs who focus exclusively on human health.
Okay, thank you. I mixed up the usage of synthetic biology.
But it definitely, yeah, it has a big application in health as well, for sure.
Great. And then next on my list, I have Laura. Laura is the founder and core lead of AthenaDAO. a DAO focused on the criminally underfunded area of women's health. And she has a background in linguistics and worked as a brand specialist, where she had already launched fashion-focused tech accessories and grew that to a large following and revenue-making successful product. Then she was a longevity advocate, active in BetaDAO and the field, and now she has started her own BioDAO focused on women's health. Laura, very happy to have you here. Do you also want to say a few words?
Thank you. I'm always very glad to represent women in these panels. I hope that in the future we have more.
If you continue doing your work, I'm sure we will. Great. So we still don't have the other Andrew around, but that won't stop me from introducing you, Andrew. So we have here Andrew Verbinen from HairDAO, a DAO focused on research into hair loss and treatments in hair loss in an open source and democratic way. Andrew graduated Hamilton College and then worked as an investor in real estate at first. And he described that as being too uninteresting to keep him in the field. And he moved into equity and crypto investing, which was more interesting. And that kind of exposed him to the BioDAO space back then with BetaDAO. And now he is the co-founder of an own DAO focused on hair loss. Yeah.
No, I appreciate that. I'd forgotten that I'd written the part about real estate being a bit boring, but yeah, no, I was investing in crypto for a while, and I think ultimately found myself, I was also sort of simultaneous. I'm 27 now. I was losing my hair when I was about 20 years old. So did a lot of personal research there on my own. And I think sort of as a crypto investor, saw the way people were building in the space. Really, I just wasn't a fan of, I thought they were sort of missing the point a lot with how you can build in crypto in a very capital efficient way that leverages like a global community, global workforce around a certain problem. And so, yeah, I figured, sort of saw BetaDAO, saw and the problems and the incentives they were sort of fixing at the NIH, and realized that a lot of those same problems could be fixed with crypto in hair loss. And so, yeah, it's looking good so far.
Very, very nice. I'm very glad to have you all here. And since we are kind of focused on bringing together the traditional science space and the decentralized science space, and sort of also translating to the audience of the traditional scientist, what is a BioDAO? I would like you guys to go into that. And maybe since you all come from different fields, we can do something that is like, when you take an image of, in ethnicity research, they do this, like you overlay a bunch of images so you have the average person of a certain ethnicity. So maybe we could do that with the BioDAOs. If we overlap all of them, then what would be the things that they have in common, like the average BioDAO? So can we maybe go into that, and anyone feels able to like average across the space and paint a picture of what is a BioDAO?
I mean, yeah, I can start out. I mean, I saw the movie Oppenheimer recently, and I thought it was pretty amazing. Like when you get all these scientists collaborating on a joint mission, sort of like the real innovation that's possible. I think it's, very few people have all of the answers to big problems in one head. And so ultimately, like the collaboration is just so key to incentivizing that. I think traditional science has just become so siloed by sort of all these researchers working in parallel, not really talking as much to each other for IP reasons, or just for like competition over the same grants. So it's become very competitive amongst researchers versus sort of problem focused, or like, around the issues, at least in our case, that plague patients. And I think BioDAOs offer a really awesome way for researchers to coordinate, be on the same team, and all sort of accrue value if they're successful in solving whatever their problem is. All
right. So collaboration, I hear. Anyone else has some.
I think the most obvious thing right now for all the BioDAOs, and I can say for the ones that are here, it's the IP NFTs. And that would take us back to obviously what the team Chris is part of. We are all doing we're all aligned in different missions, but the one thing that puts us on the same category is the utilization of the blockchain technology, the incentives, and obviously right now it's the intellectual property NFTs that, at least for now, we are all utilizing. Everybody's doing their own streams of something else, but I would say that they're also very new, right? So this is BioDAOs today. And today, the one thing that really unites them all is the fact that they came out of this concept of intellectual property NFT that obviously VitaDAO started with, that have done successful for 2.5 years. So this is now. I don't know, crypto goes so fast that maybe in 5 years, this is going to be legacy. But I would say that would be like the very obvious thing to say right now about BioDAOs.
Yeah, those were also the two things that I was expecting to get from this question, like the collaboration aspect of the community coming together behind an issue, a research topic, a research program, and the other one would be the IP NFTs. Is there anything else that one of you guys would like to add to this?
I think like back when I was working as a kind of like a biobusiness consultant, helping academics commercialize their research. I was also part of hosting an incubator program, a life science incubator program. And so I got to see a lot of different case studies of successful synbio companies. And the ones that were the most successful were also the ones with the densest network. So, you know, the network with the right people that could continuously push them to the next stage of their success. And essentially a DAO is like an aggregator of people. Everything, you know, to me at least, everything is about people who, you know, a DAO acts as a magnet for all of these things, creates incentives for people to collaborate and also spend their time to progress different assets. So, you know, in this case, all of the BioDAOs are working on progressing these IP NFTs. And why IP NFTs are very interesting is like it enables the bridging of intellectual property, of data, of technology on chain, where they can be governed by a decentralized community. I think that's really fascinating because we haven't really seen that before in any configuration of like collaboration. So there's a lot of potential for these DAOs to act as these aggregators of talents and push forward different types of assets.
Yeah, thank you. Chris, you're right on time, because now that we have seen that the core elements are really the community and the IP NFT. The question is, of course, we understand what a community is. Albert also went nicely into it, like a dense network of people that can push each other forward. Then the question is, what is an IP NFT? And that might be something that we can break down here. Could you maybe explain what that is?
I'm excited to explain it, and I think I can connect it also to this overlay. I like how you described it of what is a BioDAO, and to kind of start from there. I think I have a really positive impression of all the BioDAOs and everyone involved, everyone on this call, because we're actually all people who are, we know there's something wrong with how the intellectual property economy functions with respect to these missions that we want to achieve. And we're all out there trying, right? We're all just trying to do something better in pursuit of a patient-driven mission. And that's just awesome. That's really cool. IP NFTs work really well as an organizing tool in some way for all of us, because they're just legal primitives. We've been sort of launching them, or VitaDAO's first use case for them was simply to assign the legal rights that are included in a sponsored research agreement, which is just any old normal sponsored research agreement one might have, and simply as a PDF, put those into a token Onchain, and that's an IP NFT, right? At its essence, really, and why I, at least I get excited about just what we're building generally as an ecosystem, and I think it has revolutionary potential, is that it's really any very well crafted and defined intellectual property right more generally. It can be a licensing right, it could be an assignment of property altogether, but it's essentially a new way for us to tokenize and sort of slice and dice and carve up intellectual property rights and the definitions of what we would constitute to be intellectual property, which is, when we put that on blockchain, it's kind of incredible, because in the legacy IP economy, it's massively inefficient. It's very expensive just to participate in it. IP quality in, patent quality reviews show 50% of patents litigated on the merits are invalid. These are things, it's such a inefficient system in need of a system upgrade that Web3 actually provides. And IP NFTs are sort of the tokenized version of intellectual property that capture this cultural moment, and then we'll see where they go. So I'm sure they're going to evolve in protocol and how we're all using them, but just the mere advent of tokenized intellectual property is itself just sort of fundamentally revolutionary to the intellectual property economy more generally. And so that, I think, is sort of this cool thing that the IP NFT is simply creating liquidity with IP rights and sort of maintaining IP ownership, and then having motivated people who want to take that technology and apply it to new markets where it can only do good and sort of help further fund these DAO, public oriented missions. So I guess that's my best take on it. Hopefully that's helpful.
Yeah, I like also how, like, it gets me excited how you see this as a revolutionary thing, and I guess you really could carry that across for a person who already understands the basics of the blockchain. And I think what we have seen now is that IP NFT is pretty much like taking intellectual property and putting that on the blockchain. And it would be interesting to hear from some of you other guys who are not lawyers. Why is that exciting to you? Why did that make you start your own DAO behind that idea?
Can I take it here, specific to women's health? I think what's very interesting, and I say this, I spend half of my career selling things to people they don't need in the luxury and fashion industry. And when it comes to women's health, and why I say, you said it, criminally underfunded. More than criminally underfunded, I think is a massively overlooked opportunity. Women make the luxury industry, they make the beauty industry, they even make the healthcare industry. But when it comes to science, we've failed them across the board, from biopharma to government agencies. And I think there's something very powerful about the fact that with this new way of utilizing blockchain, because women are used to dealing with unregulated industries. They take supplements, they do Botox in their face, they know how all that stuff works. It's very powerful when they realize now they can put $50 towards an ATH token, towards foolproof science that is in an intellectually property contract, which they know science and researchers have worked through in very reputable academic institutions, and that they're actually powering this research. So once women realize, because not a lot of them know, that women's health is massively underfunded, and within their own spending power, they have the capability of powering science that is coming out of the most prestigious institutes, the best researchers, and then with that capital, we ourselves can take it from end to end. Obviously, I'm very excited about that, because nothing like that exists for specifically women's health. There is obviously a lot of beauty companies, there's a lot of supplement companies, and women, when they're motivated, they have their Facebook groups, there's all these communities, but none of them have come around science. And with blockchain, we're making that connect, because DAOs deal with different stakeholders, right? The researchers, the funders, the technology, and the communities. And that circle, it's quite powerful, and it doesn't exist in any other mechanism. A foundation has their board of, their board, and that's who manages everything. Our community doesn't have access to the science, and the funders, they're dealing more directly, like what I would call B2B, maybe like really big funders. So we're closing, instead of being in a vicious cycle, we start like a virtuous cycle of connecting the dots and making capital that women do have work for them when it comes to science. And I say this for women's health. I cannot say that that's the same for every other BioDAO, but this is how blockchain is very, the IP NFTs and blockchain is very powerful.
So this is something that when I try to like summarize what you said, I hear that it's like enables women to get behind funding their own research into their own underfunded domain by using their own money to get the scientists to produce intellectual property that will actually help serve them. So one reason to be excited for IP NFTs for you is to like take science into the hands of the end user in a way. So like fund the research that you want to see. Andrew, you open your mic. Do you want to say something?
Yeah. I would also just say, I mean, what's so cool about IP NFTs is you're taking an asset class, which is typically like, you know, who owns what IP. It's very opaque. It's like you have to like call around these TTOs, like, oh, like it's just hard to get around. And then even when you do want to say license some IP or something like that, there's all these due diligence costs and like title sort of costs that go into making sure they actually own what they say they own. And so I think there's just the IP NFT at scale when you have like a full-blown marketplace where you could just cruise, like you're buying something on Amazon and you're like, oh, I'm going to buy the IP rights for this cancer molecule, but for the indication of hair loss or something like that, that time and friction savings that just is enabled pretty much by putting things transparently, putting ownership transparently on the blockchain, is such an efficiency improvement on an order of magnitude that I think just allows for new types of entrepreneurship, particularly in biotech and the rest of science.
Nice. Another thing that Laura also hinted at was that in a way that you like that also connects to what you just said, Andrew. It's like the transparency on the one hand in the ownership and in what you're owning, and the other thing is in the research itself. So that is the same as like what you're owning in this case. But that's what you were saying, is like women can maybe pay $50 and actually get solid evidence for what they're doing. Can maybe some of you guys explain how does a BioDAO make research more transparent and accessible to somebody like a person who suffers from hair loss but is maybe not a scientist, or a woman who suffers from underfunding any kind of medical condition?
I don't know if anybody wants to take this. I can say from my side, I think we're dealing all with very different communities, because I would think the SynBio community is they understand, they would be more into very modern, very not progressive, but I would say almost like sci-fi science, right? They're like the futurist. So they might have a better understanding of science. And I would say, I don't know about the guys who are losing their hair. They probably are like the longevity guys, which are very methodical about learning the science, because they're obsessed about not learning the science. Anybody who's obsessed about not losing something, they really get into it. With women's health, I think we're obviously dealing with different areas of women's health. And I think the one thing that has the most potential is menopause, because not all women are looking forward to going through menopause. And that is like aging. It's very contentious. It takes the same amount of people that are for it, calling it a natural aspect of life, and others that say, no, it's not. So longevity people don't think that aging is something that we just have to let pass. And the same would be for menopause, but there's very different ways to deal with your communities. There's your researcher community. There's obviously also your regular community, and making that connect. It just depends on where you want to focus on. For us, we obviously want to provide also the service of translating the science, because right now women's health is a lot of it, the access and knowledge women are getting from Instagram, on TikTok, from influencers. And that is great, because some of them are great and they're actually MDs and researchers themselves, but a lot of them are not. So how do we become a hub of centralized information for women that gives them the information they need. They don't need to know about senescent cells because that's not what they care about. Most people care about what they can do for their health and what they can buy. And really translating the impact of intellectual property. I wouldn't say water it down, but take it down a notch to whatever that woman really wants to know. It's actually quite, I think it's quite a big task for us personally that we have, or the community. Because we assume a lot of things, and we learned a lot that a lot of people don't even know what a wallet is when it comes to crypto. Never mind when you get into IP NFTs, or when you get into science, senescent cells, they don't know what that is, and they don't need to know. What they need to know is that maybe they have PCOS or endometriosis, or that they had issues with their egg freezing, and that the science that we're funding could change this. So you have to really know who you're talking to, because you're talking to different people at different times, and we're dealing with very different communities constantly. That's personally what I feel it's the thing for Athena DAO, that we really have to be thinking of who our audience is all the time. And that I can say from our side. I don't think it's everybody's experience either.
Yeah, I mean, sorry, you go, Albert. My bad.
I just want to add, like, I was surprised when we initiated BioDAO, the sheer amount of non-synthetic biology biotech researchers that joined the cause. Like, for many people, it was the first time they ever heard about synthetic biology. And many of these people were actually quite frustrated about, that there wasn't any other viable means of, like, technologies that can be directly applied to solve climate challenges. So I think, what has been to our benefit is, like, we've managed to translate some of that frustration into action by these individuals. So now there are people who are, learning about the field, who are helping each other out in the DAO to learn about new research articles, sharing these kinds of things. So I think there's, so much potential in onboarding non-researchers, non-academics, non-technical people into this thing, to ultimately create and bring science much closer to everyday people. I think we talk about silos, researchers operating in silos. I think the reason is because they don't have anyone else to relate to. So I think, by bridging these different stakeholders, like everyday people, scientists, engineers, I think DAOs can do that really, really well.
So yeah, what I'm hearing is sort of like a closing of the loop between through this crowdfunding idea where patient communities can take on, or like in BioDAO you don't deal with patients, but where stakeholders can fund research into their own domains. They also become more closely connected to the scientists, and the scientists also become more closely connected to them, because the loop seems to be closed. So they are kind of also forced to explain to their source of funding what they're doing in order to continue doing that.
There's a whole new level of, like, appreciation of scientists. Like, so the researchers that we've been working with, the reason why they really like working with us and receiving funding from us is, like, it comes with so much more. There's actually a whole group of people who act as a sounding board, before their science is ultimately funded. They receive feedback on, like, how the research trajectory can be improved, or things that they've haven't really considered before from, let's say, a market translation point of view. And I think that they're very frustrated about that no other funding agency gives some sort of additional spark to their research beyond that funding.
Nice.
Yeah, I would also just add that, like, in terms of how do you open source science, I mean, you open source it by pretty much doing it in front of everybody for them to view and watch the process. I mean, I think when you're, like, we're internally generating studies that we then go out and fund in the real world, but, like, from within our Discord server. And so there's always going to be a spectrum of, like, does a person just want to try the product, or do they want to, like, learn about the process and actually contribute? And when everything's available, that then your optionality is, like, is complete, you know, versus sort of cherry picking what people get to see, what people don't get to see. You kind of make it all available. And then if people want to train themselves, it's very much possible because they have access to that information. And I think what's kind of cool, like when you're truly innovating, right, there's no right answer necessarily. It's more like arguments that slowly get closer to the truth. And so very rarely when you're really on the edge of innovation, is it going to be like, this is the right answer. The true answer is like, we don't know. And these two people have conflicting theories. Which one has the higher probability of success? That's kind of how you keep getting closer. And that's why just like the open source conversation, I think, is so critical, because that's like the essence of science, in my opinion.
Nice. That's a very interesting point that you mentioned here, the open source nature of all of this, that like allowing the community to operate out in the open. That connects to something that we heard yesterday. One of the VCs, I think it was Adam Draper, was saying that once you're like just trying to be the best, like really understand the truth, then it's not about secrets anymore. It's just about being the best. So it seems like in this model, if you can put all your science out, you are just like attracting the best talent, and you're just focusing on the innovation itself. And you don't need to be secret about it.
I also think the token will allow for cool innovations here to kind of circumvent like the traditional IP process, because absolutely like these things need to be sustainable, and a big part of sustainability is like the DAOs you know, accruing value to the IP that they create. And so what I think though, a cool way to kind of circumvent the traditional IP process is by token gating data that you generate on certain tiers, you know. So like maybe there's something that's not really critical to your IP, you need like one token. Maybe there's something that's the fundamental piece, you know, like the fundamental piece of information that secures your IP, like you need to hold a lot of tokens to the point where you're like one of the top members in the DAO. But it allows for a gradient almost of information that you're sharing, and gradients of trust versus sort of such a binary scale of like, you can't know any of this or you can know all of this information.
Nice. So there's even some creativity coming in this domain. I'm happy to hear this, but I feel like we also need to kind of talk about, if I was a scientist who until now had no idea about like IP NFTs or DAOs, like how do I get my research funded by a BioDAO? Is this a similar process for all of you, or is this different? Can somebody take us through this process of how do I get my research funded?
I can go again first. So for Athena DAO, we do it differently than I think all the BioDAOs, specifically Vita DAO. I know their process really well because I was a contributor. We do it by cohort, and that means that we do a call for submissions. So we already did ovarian aging, and we just finished PCOS and endometriosis. Each cohort comes accompanied by a health report. This last two ones were reproductive health reports, because obviously ovarian aging deals with reproduction, so does PCOS and endometriosis. But they're accompanied by a health report in which we go over some of the highlights of where science, startups, and clinicians are today in that area of research. And the reason we do it this way is because it allows us to work with specific experts at specific times. And that way we do it very focused. Andrew mentioned BioDAOs being sustainable. The best way to be sustainable is to get to something very fast, other than any other platforms that any other the BioDAOs are developing on their own. Obviously, you want to have assets under management that are valuable, and you need to get to translation as fast as possible. So you have to be have a very good method of looking at science to try to get to something that obviously ends up being a licensable product, a company, or basically something that can bring things back to the treasury other than whatever else you're developing in tandem. So that's how we do it. We do call for submissions. That doesn't mean that we do not accept. If you put a submission for a project, we meet amazing researchers all the time. And even if it's not PCOS or end, we say send it. But obviously, I do think that the very focus looking at different areas of research, even though we believe in systems biology, and that's something we're trying to figure out, how can we connect scientists to each other because they don't talk in different areas of research as much. When it comes to vetting the science and looking what could potentially be an IP NFT, we found that doing this very targeted approach for now works. I guess we'll tell you in 12 months if we had the results we wanted, because we would have gone through 3 or 4 cycles already of different areas of research.
Nice.
And that's for DAO and women's health research.
This raises another interesting question that I would like to get into afterwards, is like, how do you do the internal selection process? But before we do that, maybe some of the other guys can take us through their process. Maybe Andrew, you welcome actually. Andrew B, I'll call you, because you didn't get to introduce yourself and so on. But maybe you could speak about how a scientist can, get funding from HairDAO if they are researching in that area.
Yeah. So we talked to, or so our community encompasses both, I would say, like the best traditional hair loss researchers, and then also like a really strong group of internet native hair loss researchers. And like, frankly, like the best may actually be in the internet native group. So we field ideas like both through email and then also like Andrew was saying before, on our Discord server. But regardless of where the inflow comes in from, like it's very much a competition, like which ideas in the Discord get the most popularity, like constant peer review. Obviously, the bigger your community is, the more people that are looking at all the ideas, providing feedback. And what's really cool is, like, as the ideas get traction, people from the community keep pushing it forward. So like we have one piece of research which is about to enter like more so like the observational study stage, so actual human in vivo testing. And we had researchers step in to help us do the business development work necessary to get that to hopefully where we can cross the finish line. And then also, like with the early stage ideas, people are constantly debating gene targets, like which tests we should do to validate which targets, et cetera. So yeah, it ultimately becomes very competitive in our Discord wherever the ideas come from.
Okay, nice. So this makes it sound like the community of hair loss interested people is already gathered on your Discord, and you have to basically compete in the intellectual debate with the other scientists, and it's a sort of a bottom-up way so that the best research sort of emerges out of that collective conversation.
Yeah, exactly. That's beautifully put.
Nice. So Albert, do you also want to describe your process? You were looking kind of appreciate it.
Yeah, so quite similar to Laura's and like AthenaDAO's process. We don't have focused funding calls, but we're actually going to start with that. We've, for the last 2-3 months, looked at various domains of SynBio, because it's a very horizontal field. There's like over 30-40 different applications, over 300 different research labs in the world working on their own things. So what we've done is, like, we've looked at the most promising areas that actually works today. Unfortunately, a lot of SynBio research is not going to mature until like 5 to 10 years until we see it, working at a scale that is cost efficient and that can result in actual products on the market that any day person can buy. So we built deep knowledge expertise by actually, and I can also recommend this to anyone who wants to build a thesis in SynBio, is look at the national grant databases in Europe, in the US, and see who received the grants in the last 5 years. So what we've done is, like, we looked at the labs who received grants around 2-3 years ago, and where the grant money is coming to its end. If you focus on those research labs, you can guarantee that they've had funding for this focused area, and they're running out of funding. So you're coming in at a very good opportunity to provide your opportunity to them. And they usually have quite mature technologies already due to the previous funding that they had. So it works very well of coming in at the when the research is about to be translated. Usually when we reach out to them, they have some IP that needs a little bit more of funding to kind of like complete it and make it sort of like market ready to be spun out or licensed to a larger corporation. So yeah, that's how we narrow down. That's how we stay focused. And really, you know, when somebody applies or we find someone that we'd like to fund, we take them through a due diligence process where we bring in different subject matter experts from the community, or if it's a very niched subject area, we go out and find the right person. And we make sure that they're properly incentivized and that they know their field, have them review the project, and then finally we bring it to a community vote with the assessment from these different subject matter experts, so that the community can make the most educated decision, the most informed decision possible.
Nice. So there are some individual differences here in the fields. I see also the scope of like hair loss and synthetic biology go far apart. Chris, do you also want to take us through the process of CyDAO, and then maybe we go into some of your success stories and how this has already worked out?
Yeah. You know, with CyDAO, we actually haven't funded any deals yet, and have been. It's had a couple of false starts or something. The community's gotten active, and then we, for whatever reason, just shifting people, haven't ended up launching a token. And now it seems like the plan we're building, we're currently collaborating with Robin Carhart-Harris, who's one of the world's leading psychedelic researchers based at UCSF, who is at Imperial College. And we are working with him and Unlimited Sciences, which I think they did the large data survey collection for Johns Hopkins. That was the largest done for a psychedelic survey. And they just published some really interesting results on that. But they're planning to team up. They want to help support Robin's new lab. And that, as part of that new lab, we want to have this kind of open science survey engine that Balazs Szigeti, this great postdoc, came up with. And he sort of has become well known for his paper on self-blinded microdosing. So really kind of this cool thought leader on citizen science and open science in the psychedelic space. And he works around Robin's lab as well. So we have this kind of collaboration going. And I think it will likely be the project that is launched at the same time as a token, or, you know, to help fund part of it. But what's interesting about this whole process really is that CyDAO in some ways has moved for the time being into being something that's product focused in its launch, which is to say, we really want to be building out this token protocol for making an open science survey engine inside the psychedelics market. And we think for a host of reasons, the psychedelics market is unique in really needing citizen science to really improve research and IP validation more generally, because it's been criminalized for so long. So it is, for a host of other reasons as well, it's a perfect market to get these new tools, you know, these tokenized IP tools sort of into action, and to figure out, all right, how can we co-organize here in a way where also in the psychedelic space, the ethics of intellectual property are just at the forefront of many concerns around commercialization and the mainstreaming of the market, and in particular, an erosion and a kind of an attack on indigenous peoples and sort of plant medicine and what's called traditional knowledge in the IP economy that doesn't get protected by anything, and is oftentimes sort of what people come to as public culture, but it just means it can be a pretty intense exchange for people. And what's cool about CyDAO and tokenized IP as well is that we're building a network of people who have been active in the space, of indigenous advisors and things where, as we try and, you know, do a system upgrade for the IP system in the psychedelics market, we can use a DAO and this tokenized IP platform and some just innovation in tokenized IP that I love kind of across the board, just agree across the board with what everyone was sharing about how there's a new design space. So I actually think SciDAO is likely to maybe take that approach for a little bit. It kind of makes sense to deploy a designed, I don't know, intervention in the justice system for the IP, for the psychedelic IP economy. And that I think should be hopefully supportive of the whole ecosystem, because the more we can be innovating with these tools, it goes back to the open source point. All of the legal tools, of course, they have to be open source fully without conditions, because it's just contracts that people can see, right? It's just, that's of course fine. And what's interesting, I think, about what we're doing in BioDAOs and with Web3 and with this, again, new layer of tokenized IP, is we're also moving past some unhelpful assumptions that occur when open source just means complete relinquishment of IP altogether. Throw something into the public domain where you go, great, but all you're doing is reifying existing market power. They're just going to come in and take this, and it doesn't do anything really to structurally change the economic patterns that I think we all want to sort of solve for. And so I think kind of offering technologies that just enable new means of interaction with IP there just end up being a big help.
Yeah, this has been very interesting to see how indeed this is a design space, because all these different areas of research have slightly different approaches here on how do you fund it, what you guys are doing. But one thing that I hear is like, it seems to be really important, is this like commonality of the mission that we see, for example, in HairDAO. It seems to work out really well, that this narrow and clear idea of what they're trying to target allows a group of interested people who are solving that problem to come together and actually fund and basically rally behind that goal and try to achieve it. Can we maybe hear some of like the success stories? I think yesterday it was mentioned that HairDAO is already in the process of like producing a medicine. Maybe that would be an interesting story to tell. How did you pull that off?
Totally. And Bax, feel free to chip in as well on this one. But yeah, it was the very first research study we funded. We did it with Professor Ralph Paus out of the University of Miami. I'm actually going down there to work with him next week, which is super exciting. But yeah, we ran an in vitro test on a T3 T4 thyroid hormone combination formulation. We prolong the antigen growth phase of the follicles on a human scalp skin biopsy. Now T3 or thyroid hormones are widely prescribed for people with orally at much higher dosages for people with underactive thyroid hormones. So there's a ton of available safety data on it. Now what we're really trying to figure out is the efficacy data. Like, will this regrow hair in vivo, which is ultimately like the most important thing. We always joke, like, we have the meme of like the bell curve of intelligence, and it's just like human in vivo on either side of it. Like, that's ultimately all that matters, regardless of all these sort of like disease models that people use in hair loss, like mice, for example, which just really aren't very relevant for the human hair follicle. Yeah, because we've gotten great in vitro data, we've lined up our compounding pharmacy, we've lined up doctors who are willing to prescribe it off label, and we're running, starting within probably, within a month from now, we're running an observational study in vivo. Bax and I are both taking it ourselves. We are participants in this trial. We're obviously confident in it, and if we're going to talk the talk, we should probably walk the walk. So we're doing that. Yeah, we're in the process of signing people up for the trial. So if anybody's interested, please hop in the Discord, and you're in Miami, we'd love to include you in the trial. There'll be some sort of like IP fractionalized ownership if you participate in the trial. But it's going to be a super official trial from a data collection standpoint. It won't be like a clinical trial that's recognized by the FDA, but we think it'll have all of the, we think we'll collect all of the data to hopefully make patients feel comfortable that it's safe and effective. And yeah, we're going to find out in the coming months, like if we can really regrow hair in people. And if we can, that's a brand new product. that's available for all hair loss patients, like literally within the month. So super exciting.
That is exciting indeed. Yeah, it's cool to see that you guys are taking medicine, like starting the journey of founding the DAO, and actually now having a product that you're so confident that you're going to participate in the trial.
Yeah.
Maybe we can have one more success story. If anybody wants to really share, please step up. And then otherwise I would ask some critical questions and about a little bit about the drawbacks of like the challenges that are also part of
I'd like to say that it's a success that we've raised over $500,000 for women's health from the crypto ecosystem.
Absolutely.
Because that's a big deal, that it all came from Web3 funders. That means that we got a bunch of men that didn't care usually for women's health to care. And $500,000 is not just little change. So we're very excited, because if we can do this during the bear times, imagine what we can do during the bull run. And our auction really showed the interest by the general public, because 83 of our bids were people under $1,000. It wasn't the regular Web3 funders or big checks. It was just our community and women that just thought, okay, I need to put some capital into this. So we're very excited about that, because it means that if we take the time to educate, we've done a lot of education in bringing female researchers into DeSci, people that didn't know what a wallet was, what the crypto is. And we did a lot of that for women as well. So we think that, I mean, we're very excited, because we do see the potential of being able to onboard the next wave of Web3 users that are going to be women that actually do have capital, but they just need to get educated and be driven by a mission that really matters to them. So to us, that's like a big win, because they're not usually crypto natives. This is their first wallet. This is their first token auction, and that's massive. That they're willing to put more than $50 on this, and they did it with us. So we're very excited about that.
Laura, that's really incredible that you pulled in so many non-crypto traditional people into the ecosystem. What did you do? Like, what was your strategy to do that?
We took the time to educate people. You know, we created the DeSci 101. We did the sessions. I say always go to where people are, not where you are at. And it still needs another layer. But I don't know if you guys noticed, we've done a lot. Athena DAO has done a lot in pushing decentralized science, even as a community effort. We did the breakfast around the world. We did the DeSci 101, the office hours. Like, if it meant that one of us was helping somebody online with their wallet, that's what we did. I mean, if we can do that with the means that we had then, I know that with the means that we have in 6 months, or even already now, we can do so much more if there's like a bull run, right? So we're so much better prepared, because we already know what works and what doesn't, and where we need to put more of that. But it's basically educating people. And I said it many times, the NFTs, collecting digital PHPs might not be like a woman's thing. The DeFi thing might not be a woman's thing, but if you touch them with something that matters to them, and women's health matters to all of them, and they know that it's about mission, that is the big opportunity, right? That's why we work so hard. And it goes back to your original question, Jonathan, taking it away from the hard biotech science that we deal with and making it very digestible and easy to understand to women, the end use for them. And the end use for us is when it's crystal clear that those $50 that you could use on supplements that do nothing for you could be better put to fund a research by a scientist that doesn't usually get this funding, and it could potentially actually generate better fertility treatments, delaying ovarian aging, better diagnostics for PCOS and endometriosis, autoimmune diseases. I mean, the list goes on and on and on. So it's a massive opportunity. There's so much to tackle. Obviously, it's going to take more than us just doing it. And it's going to take a lot of growth and obviously a whole lot more capital, but it's about getting the people that are not traditionally involved. That is the next biggest opportunity in the ecosystem. We believe that fully.
Yeah, I see that point clearly. Like, the education is really important part of like also what I've been trying to do today in this panel, like to explain to people what is actually going on. And not only women need to be informed, but even traditional scientists need to be informed what is happening in this domain, which in itself is a scientific enterprise to like create the consensus algorithms that drive the new forms of creating research, funding research, and ultimately contributing to the knowledge. And for what it's worth, you definitely conveyed the idea to me of how valuable an Athena DAO token might be, because owning a stake in the intellectual property that is behind women's health, it certainly makes a lot of sense if it's 50% of the population and it has been neglected. Maybe they'll find something really quick because it seems like a very low-hanging fruit. So
well, just one thing quickly, one Athena DAO token might lead to one more baby on Earth. And since we're going to the population, it's quite a big mission. You know, with some Athena DAO tokens, you could be funding research that improves fertility rates. Isn't everybody worried about that? And it doesn't just impact women, it impacts society in general.
Certainly a great mission. And to me, it makes a lot of sense. But there's also seems to be like a unique set of challenges in a DAO. Because coordination seems to be so much more let's say chaotic. Can you maybe address some of this? Like, some argue that it's making research more transparent, and others say it's not actually more transparent and it's not more clear. So where do you stand on this debate, and what are maybe the challenges that you have experienced? How did you address them on the way so far?
Are you talking about governance or the science?
Let's say governance, or in general, like I don't know exactly what challenges you might have experienced as like leaders of a BioDAO, but maybe what was the most challenging thing that you had to overcome as like the founder of HairDAO, and how did you overcome?
For us,
what are you struggling with still?
Yeah, well, for us, I think the biggest hurdle was learning the biology, because like we had no real bio background before starting HairDAO, so that was, I think, the biggest hurdle. But what's cool is I think we're kind of at the point where we are better at that, and that's a really cool part about being involved with one of these DAOs too, is that you upskill yourself as you go. So yeah, I would say that was our biggest hurdle.
Nice. This ties so nicely into what we have been talking about, like the education part that Laura was just mentioning, and how non-scientists become scientists over the course of getting involved in the DAO. That's also what Albert was saying earlier. So that seems to be one of the biggest challenges, just like we have just mentioned, to actually translate the science and teach people and teach them how to learn these concrete, like seemingly difficult, but in the end, often quite concrete points.
100%. Education is like a huge part. We're actually launching a kind of video game type products called Ready Player One that hopefully does what you're talking about in terms of helping more people up level.
Nice.
My personal goal is to get to the point where like Ready Player One level 10 is like more impressive than like getting your PhD at some traditional university for hair loss at least. And there's no reason that can't be applied to every indication.
I see. So it also decentralizes education, so in a way, like the best teachers for hair loss are not necessarily in universities, but probably on your Discord.
Yep.
Yeah, nice. Then maybe Chris, you could talk to some challenges that you had encountered maybe inside our, where you said that there were some challenges like a shift in leadership or things like this.
Yeah, I mean, I wasn't involved inside out until this sort of round, so I don't probably can't comment too well on the legacy bumps there. But more generally, I mean, I think that because we're building new culture and there's a lot of different types of interests, and these are powerful assets that we're playing with real money. That's hard, it's hard. We kind of lack the imagination because we lack the practice of being able to organize ourselves around intellectual property in a liquid market, without that being inside a corporate silo or something like this. We've never sort of organized ourselves as IP producers, which is really kind of what everyone is, given the ubiquity of the IP economy and that copyright applies. The questions in the copyright space as to who can or can't be an IP producer are at the level of species. There's actually case law saying monkeys, this monkey took a selfie. Yeah, monkey gets some rights. Monkey gets some money, and essentially I think it was a settlement for the photo he took of himself that ensured he was going to be well fed, something like this. But that's the level where we're at of what is necessary to be an IP producer. And I think when we want to expand, make that as inclusive as possible and keep thinking about new ways to have people come in, gamifying things like what HairDAO is doing, to me, just makes a ton of sense and is a really powerful way, I think, of organizing people into productive pursuits by essentially transforming how and where conflict arises. And I think that more generally inside DAO is when we launch what would be sort of this psychedelic commons, it would be something that has been sort of well designed, to think about an IP justice system that invokes and incorporates a ton of work that's already been done by people in the space outside of Web3, right? The psychedelic space is just full of people who've been thinking really carefully about all of this for a long time. And so thinking about, well, how also can we just plug in a tokenized DAO form of this to support, essentially to just make it easier for those parts to communicate with IP and support one another, and have an alternative toolkit and means for experimentation.
All right, there's one audience question which I would like to ask. And we are at the end of this panel. Maybe we can take this 2 minutes to go over this, but to tie everything together that we have been talking, it seems like, from what I understand, the IP NFT enables the scientists to rally funding behind their research, and then also own the intellectual property, and thereby kind of become. So yesterday somebody said they are the hero. They should be the hero of the scientific journey. And they can be the hero by engaging in this, and then their challenge becomes to translate that research to the people who might want to fund it. As we have seen today, that seems to be one of the biggest problems here. And then there's another question in the audience, which also relates to one of the challenges, which is, could you elucidate your forthcoming procedural measures regarding the management of global regulatory frameworks pertinent to your DAOs? So the regulatory problems that are there in the space, could maybe somebody address them?
I want to take this because I have a different take. I still want my PhD, like one of the contributors, to be the one that takes care of the science on my ovaries. It's not going to be me who is going to figure out if my ovaries are going to live longer by biohacking myself personally. That's for me. I think that we still need to work with established academic institutes. I think the most amazing thing we could do is bridge their reputation and establishments with what we're doing here, which is the hyper-financialization of science, which some areas of science do need. And one of the biggest things for us, for instance, for Athena DAO, is to work 1000% within all regulatory frameworks. For instance, our deal flow is under NDA. Why? Because if I want to work with biotech, if I want to sell my IP, I'm going to have to show them that we went through all protocols of due diligence, and the only thing that they will touch, that we know who saw it. So I think that's and that's why I think all the DAOs are different, because we all have different frameworks that we want to work with. And for instance, for us, our key is women's health, as I said, is overlooked. It doesn't mean that there's a ton of IP out there probably that is sitting in just, Chris talks about IP a lot, but I think of all the innovation that's probably sitting in a lab that hasn't seen the light of day simply because of funding, not because of anything else other than that. So for us, our thing is establishing those networks that really make the connect between Web3 and academia, and not necessarily say, oh, we're going to change everything. Because in the end, I make this example. Everybody hates the New York Times. But if you get written up in the New York Times, you will tell everybody that you were in the New York Times. It's the same with Nature. No, oh, Nature, like publishing is expensive. But if you get in Nature, you'd speak about that you were published in Nature. So it's too hard to change that reputation too fast. And we're going to have to figure out a way to bridge from past legacy reputation to our own reputations that we're building and how they are going to interact with each other, where one day in the future, potentially what we're building will be at the same level of reputation and playing field. But that's a process. And that process is going to require that we do work within regulatory frameworks or change them in a way that do make sense within those frameworks already. And I say this again, this is very particular to women's health, and this is how we're doing things, but I don't think it applies to all the BioDAOs. And that's what's amazing about BioDAOs, is that they're all their own experiment and their own thing.
So in 1 minute, we have the next speaker coming on. So if anyone has one last word, I'll allow it, but then we have to hang on. No, great. Thank you, Laura, for finishing this off with the point of with this inclusive point. And yeah, thank you everyone for coming on, chatting about your successes and about your challenges, about what IP NFTs are, and enlightening our audience as to what this is and where it's going. So
thank you for having us. Nice seeing everybody again.
Yeah, thanks so much.
Yes.
Look forward to seeing everyone soon, I hope.
Yeah. See you.
Thank you guys. Bye.
Bye.
Okay. Great. So I'm going to go ahead and bring up Jelani now. And then also our speaker coming up here, Nicholas from LabDAO. And Jelani, if you want to go ahead, just because we're right on time here, feel free to maybe introduce yourself, introduce a little bit about DeSci World and how they're aggregating a lot of things around the DeSci space, and then maybe give an introduction to Nicholas here.
For sure. So as mentioned, my name is Jelani, neuroimmunologist by training, and I'm one of the executive leads at DeSci World. And very briefly, DeSci World as a platform's whole focus is on broadening the awareness and participation in decentralized science. So providing easily digestible format of information so that people can learn about some of the amazing projects like the BioDAOs that we just saw, and many of the other projects that we're going to see today, and learning about and how can they participate, how can they be active, and how can they help push the mission statement. So that's what we're here for, and that's what we like to do. I'm going to be the moderator for the next series of talks and panels, and I'm looking very much forward, and I'm very thankful to the ResearchHub Foundation and SciCon for giving the opportunity to do so. So with all of that being said, I'd like to kick off this by first introducing Dr. Nicholas Rintorf here, who is the co-founder and CEO of the Open Lab Association, which is alternatively known as LabDAO. Dr. Rintorf hails from the healthcare industry, where as a physician scientist, his research focused on improving treatment recommendations in specific oncology through image-based profiling of compound effects in patient-derived organoids. And that's something that's very close to my heart as somebody who has worked in the development of stem cell pipelines and understands the need for these somewhat in vivo, in vitro hybrid situations that can help us better understand treatments. Now, this commitment to improving quality of life through science has since followed him in his journey into Web3, where he has helped co-found LabDAO, an online research collective that provides access to and develops open tools and infrastructure for computational life science research. And in today's talk, he's going to be regaling us and giving us the pleasure of learning about one of their flagship tools, which is known as Plex. And I'm very much looking forward to it. And I'm sure I can speak to the rest of the crowd for that. And so with all that being said, and without further ado, Nicholas, it is very good to see you again. Thank you for sharing your time with us and giving us the opportunity to learn about some of the great things that you guys are doing at LabDAO and how we as scientists and science enthusiasts can leverage Plex to help improve our research. So the floor is yours.
Thank you so much for the introduction, and thank you to the whole ResearchHub team for having me on this great conference. Yeah, as Jelani already introduced, my journey started very much in translational research and in more particular in image-based profiling, which is for the uninitiated, a very data-intensive way to study how cells or any form of in vitro model of disease reacts to treatments. And during these projects, both in the States, but also in Germany, where I'm calling in from today, the recurring theme that we always ran into was that we accumulated lots of data. And I'm speaking not sort of genomic scale data, but really, it's a lot of imaging data. So we're easily talking terabytes per experiment. And over the course of, a couple of months, one could easily accumulate hundreds of terabytes of information. So very quickly, this type of research, although it's sort of biomedically motivated, is very much determined by your ability as a scientist to process large data and to then also effectively share large data. And this was very much sort of the origin story for LabDAO, this idea that there should be a way for scientists to share their data and the tools that they also built with each other in a more permissionless and direct way. And for that, for the next 30 minutes, I'm going to be also able to share some slides if the organizers let me. All right, there we go. Okay. So the initial idea that we had with the Lab Exchange was that we wanted to create a space where people can trade laboratory services. So usually when you were in a university, you would have something like a core facility. But what is the core facility for scientists that are living in countries that might not have all the infrastructure that they need to get their work done? Or where's the core facility for startup founders that are not based in any of the large hubs? How can they sort of test an idea? How can a college student, for example, run an experiment if they're able to convince enough people online that their idea has merit? So with this idea, we said, okay, we want to create a new form of organization, a DAO, around this idea of a lab exchange, where there would be permissionless participation, distributed storage to make sure that whatever data was created was kept in a secure way, and also token-based ownership of the results, so that if I was located in location A, I could pay someone in location B to process data that I want to be analyzed, and tokens can track who has rights to what pieces of the data that is being created, and there's a neutral platform which I can pay that scientist to do the work. So with this open source exchange outline, what we, however, relatively quickly understood was that this was a very large task, and we needed to break it down. And when we looked at the state of computational biology, it was clear that there was a lot of room for improvement. If this was sort of an in-person event, I would ask the audience what you think you're seeing here. But I'm just gonna after you can take a moment of looking at this, I can explain to you what's going on here. So this is an example from a tweet in a laboratory, actually in a relatively well-equipped laboratory in Munich, where in order to run a computational biology tool that was very popular at the time, and I think still is, the scientists went back to using these free Google Colab notebooks. And because Google Colab notebooks, they time out. They put the mouse of the computer on a roller to keep the mouse active, so the computer doesn't time out and the Google Colab notebook session doesn't time out. Why is this sort of the way that we still share computational tools between scientists, using sort of that type of platform where scientists can't just permissionlessly, for example, use the tool? They cannot scale it up easily if they need to, and they cannot track results because these types of notebook sessions, they die out extremely quickly. So what we did was we sort of simplified the spec of the Lab Exchange in its first version, and we called it Plex, where Plex is the Plex Lab Exchange. It's a Python package that enables permissionless participation, distributed storage of results, and distributed compute as well. And I'm going to go into a bit of what all of that means in a bit. So when a user is accessing the Lab Exchange, they're submitting a compute request, which can basically be any arbitrary Docker container for all the computational biologists in the audience. So those tools can be, protein folding, small molecule docking, protein designs. These are applications that we already have. Applications that we're onboarding in the next couple of weeks are going to be genome assembly, genome annotation, and then also I think some more sort of exotic applications that are related to drug discovery and sort of more advanced drug discovery. Now, one thing that, however, was missing in the Lab Exchange until recently was token ownership. So when I submitted a request to the compute network, one of the nodes in the network would pick that request up and they would process it and they would post the results back on a distributed storage system that's called IPFS. I'm going to go into that in just a bit. But there was no sort of permanent record of that work being done. And the person that submitted the request to the exchange, they didn't keep something. They couldn't claim that they actually did this analysis run. And also they couldn't share it easily what they just did until recently. So what I'm introducing today, and we announced it, I think, a couple of days ago, is records, and something we've been working on over the last weeks after we launched the Lab Exchange earlier in the year, which allows you ownership, grants you ownership rights over the scientific data that you create. So it's, again, sort of integrated in our fully open source Python API, and gives you access to some of the latest biomachine learning tools running on top of this distributed compute and storage network. Every time you mint a record, you're assigned rights to the output, so that those are just basic copyrights right now to all the creative output that might come with the work that you've done. But what we're really interested in is eventually bundling these records into like fully fledged intellectual property claims that are equivalent to like a patent application. The way that you can use this right now is literally from any place where you can run Python. So this is just an example out of a Colab notebook. And when you use Plex and you want to mint a record, you can, for example, install the package here, and you want to run AlphaFold. You can put in the sequence of the protein where the structure is that you want to predict. You put in your wallet, which is basically your user account, and you hit go, and off, you sort of send out a compute job, and eventually when everything goes well, you do mint a record. Now, how does all of this work? So I'm going to walk a bit through, the three pieces that records consist of. At the bottom layer, we have a storage system, and on top of that, we have a compute system that's called BioDAO. And in the top layer, we have a permission and ownership system that's just powered by basic NFT contracts that we're running on Optimus and testnet at this moment in time. Some of these words might not be familiar to everybody in this audience, so I'm going to take some extra time to explain to you what's behind these individual technologies and why I believe they're so ridiculously important to the way that science as is going to work. I think generally when we talk about decentralized science, we think a lot about levels of ownership and engaging online communities, but I do seriously believe that once you come for that type of excitement and the community engagement, but I think you're eventually going to stay for the sort of fundamentally superior guarantees that some of these compute infrastructures give scientists to collaborate more easily with each other. I'm very excited to go into them now step by step. So at the bottom layer, we're looking at storage. And, when you have files on your computer at home, most of these files are probably addressed with, home/Nicholas downloads project 1. And that's where you keep all your files. And if you build a script, a piece of code that analyzes this data, and you share the script with someone else, that's most likely not going to work because their first name is not Nicholas. They have a different name. And so their laptop has different file system structures. So suddenly whatever you did is not reproducible. Now, people have worked on solving these problems, and there are multiple different solutions. But I think one of the most elegant ones is content address storage. So here you use a hash function to create unique identifiers for every data file that is available on the storage system. And we're using one of these storage systems that's called IPFS, which is the largest of these distributed storage systems. And what this address gives you is it's a unique hash identifier that has standard length that is the unique address of this file. And no matter where in a peer-to-peer network that file is located, you will always find that file based on this address. And this is obviously a more robust solution relative to a standard server client model that we're knowing from the sort of Web 2 world, where you just need to hope that the laboratory or department server doesn't shut off or if you still want to keep access to your data. And there's probably always one PhD student that has the very unfortunate role of making sure that this department server keeps running, depending on where you are in the world and what the infrastructure of your research organization is. So this is a robust sort of way of storing data. Now, what's even more interesting, I believe, is that you can pair these distributed peer-to-peer storage systems with also peer-to-peer computing systems. And the reason why I'm excited about this, because there are two problems in biology that are very prevalent, and peer-to-peer compute does solve both of them. So the first problem is we have very large data sets depending on where we are. And then the second problem is we always have very prototype grade code with very exotic dependencies. So we have serious data, and you could say for anybody who's worked sort of in tech professionally, pretty unserious code. And so the solution to make both of these work with each other is to move the compute into containers. So whatever code we're writing, we just try to bottle it up so it is as robust as possible, and it doesn't matter on where it is run. And then, because the data is very large, we don't move the data to the compute, we move the compute to the data. And this is what the BioDAO network enables. And then, on the third layer, not only do you need to have a sort of container runtime, so basically a system that allows you to run arbitrary containers, you also want to perhaps, add your own tool, add your own container, and make that as easily as possible. So what we looked into was sort of inspired by a standard that's called the Common Workflow Language that allows you to specify arbitrary, applications by you just filling out a JSON document. So if you, for example, have a tool in your laboratory and you're counting cells, and you have a container in which that code exists, you can put that into one of these documents, and you say, okay, the input is for example, a file that is an image, and the output is a CSV file that has all the cell counts. And then you give the command line argument that you would run, and it would then be a tool that can already be executed on this peer-to-peer network. The philosophy that we follow when we design these types of specifications is very much sort of inspired by sort of consistent instructions that we know from like recipes. So here, for example, we have, when you want to create a pie, you have very clear definitions of what, are your ingredients. For everybody who's interested in category theory, you might remember this sort of meringue pie example that I'm showing you here. Then you need to have a block in which you define, what's actually happening under the hood with these ingredients, and then you need to type your output. You need to be specific about what comes out. And we took this approach, like all the applications that we're onboarding, where, for example, when you run a docking model, you have a protein with a very specifically typed file that is that protein, and then you have a typed input for the small molecule. You have a well-described set of operations that are happening under the hood, and then eventually you end up with an output that is well-defined. Now, we have, as I said in the beginning, we've onboarded a whole series of tools. So we have tools for small molecule binding, protein folding, and there are more tools coming as well. You can head to our docs.lab.xyz to learn about what's out there. And then, as I said, there are also more tools on the way: genome assembly, protein binder design. So actually designing proteins that bind tightly to a target that's implicated in the disease or that you want to further study. All of these tools are already available, and we would love to help you use them in whatever context your research might find them useful. Now, the third layer of the stack are non-fungible tokens. So this is literally an example on OpenSea testnet that you can look at yourself today. So all our records, they have sort of random generated names right now. And when you look under the hood of what these tokens contain, I think all of what I just told you comes together really nicely. So every token that we mint basically has a section that we call sort of a graph that contains the specification of the input, the specification of the output, and a tool reference that makes sure, that contains the container image and all the input-output relationships. Now, in this particular case, we docked a small molecule against a protein. This is a very standard thing that you do in the earliest stages of a drug discovery project. And we have these unique hashes that I mentioned in the beginning for both the file that is the protein and the file that is the small molecule, and the same thing also for the thing that came out. So with this, we believe we have basically the most reproducible format to capture what a scientist did. In this particular operation, a scientist took two files, they docked them against each other, and they have a proof, a record of doing that at a given moment in time, because all of this information is minted as an NFT on chain. And because that is not sort of, I believe, cool enough that you can actually show others, this is literally what I did, and you can rerun it, and we can work together, and you can, build on top of my Lego block. What we also do is we dip into certain license contracts that have been developed, for example, by the A16Z crypto team. So all of our contracts right now, all of our smart contracts that you use to mint these NFTs, they give the holder of the NFT an exclusive license on the copyright and data ownership rights. And again, as I said in the beginning, what we're really interested in is building the infrastructure that now lets you collect all these Lego blocks and eventually bundle them together into serious intellectual property portfolios, so that you as a scientist can collaborate with whoever you want, and you can sort of start, really collecting the work that you're doing. Now, these licenses also let you choose the terms under which you want to license your work. So if you, for example, don't want to have an exclusive license to your work, you can also do sort of a CC0 style license to your work. So you have the flexibility to just control how your work should be treated. What can records do? So we're using this technology pretty actively and trying to really test it in the field. So what we were looking at is partnering with companies and also academic researchers that have a computational biology problem. They think one of our tools might be helpful, or they have one particular tool in mind that they would, like us to onboard. We are currently looking for these types of pilot projects, and if you're interested in working together, we would love to, get to know you. Here's some examples of what we're doing right now. This is a pilot that we're doing with a company out of the US, Leo Labs. They're designing protein binders for oncology targets, where we're using some of our protein binder design tools, Colab Design, RF Diffusion, Protein MPNN, to design proteins that bind very tightly to surface markers that are associated with cancer cells. Here's another example of a company that we started working with. And this is an engine, a docking engine. It's called UniDock. It's extremely fast on A100 GPUs, unprecedented, I think, speed, or definitely sort of in the top tier of high velocity docking engines. And here, we onboarded these tools and we make them available, and we test, to what extent are they competitive with other platforms that don't have a lot of these guarantees that our system has. And finally, here's an example of a collaboration with another DAO, where we analyze data for this community and help them sort of make decisions in their further drug development sponsoring process. Last, I think one sort of relatively recent case study that we did was we partnered with Protocol Labs to move the whole Facebook AI research protein structure catalog, the ESM atlas, onto IPFS, and hopefully soon also Filecoin, so that this data is preserved and also right at the fingertips for scientists that want to use our platform to do their work. Now, these might be a bit abstract because they're basically, these vignettes are telling you what we're doing for other people. If you just want to get started today, here's some things that you can do right now. We launched about 30 days ago, and up to this point, about 200 records have been minted. And we would love you to also mint one. We have new tools that we just ordered, for example, this protein binder design tool. And you can head to try.labdao.xyz. I'm going to share that link in just the end of the presentation to give it a spin and mint your own. Now, I want to sort of end, and I know I'm also coming up on time. I want to end with what I think is sort of an ecosystem view. How do we at LabDAO, how do we at Convexity Labs, the company that's supporting the project, and the Open Lab Association that's hosting it, how do we think about the components of this ecosystem, this wider ecosystem, and where we fit in? And what we currently see are two components. So we have governance tokens and we have legal sort of wrapper tokens. So governance tokens, these are tokens, ERC20 tokens. I think ResearchHub has a governance token. A lot of these other BioDAOs have governance tokens. And these tokens can be used to, for example, pool funds to sponsor research. And this is sort of the perfect segue to this other token type, which are these legal wrapper tokens. So these are tokens that you mint in collaboration with a university tech transfer office, where the online community has pooled their money and they're now paying the university researcher in return for some legal guarantees to the intellectual property that is handled by the technology transfer office. So usually there's basically an edge between the governance token and the legal token. You raise funding through the governance tokens and you decide on what to fund, and then in return for funding a scientist, you get a legal right. What is sort of missing from our perspective is the actual, direct relationship with the scientists, and especially this sort of bottom-up scientific relationship. So this is very much sort of a Netflix model where you bring together your online community and then you partner with movie studios and you sort of out-license the movies that they're producing. We're way more interested in YouTube than in Netflix. We want people to just create and not have to ask anybody. And we want people to just create, collaborate with their creation and see where it takes them. And maybe their creations are the starting point for, their own DAO, where they're interested in one particular aspect of scientific computing, or what they start accumulating might eventually lead to a legal contract, or might fit really well with an existing sponsored and financed research project. And this is really what we want records to be, sort of closing the loop of, I think, the decentralized science and decentralized finance stack, where now scientists themselves have their own cultural product and they can contribute it to the ecosystem, where I don't need to have my own online community and I don't need to have a sponsored legal agreement to do my research. I just get going and I start collecting these records, and I see where it takes me. Maybe I find other scientists and I vibe with them and I start creating my own online community around the records that we've amassed. Or, eventually, perhaps, I can take this a step further and turn it into a fully financed and sponsored research project. Now, with that, I hope I was able to give you an overview about the Lab Exchange, what you can do right now, how records fit into the equation, and our current perspective on this wider ecosystem that we sort of continue to be extremely excited about. Thank you. You can take a look.
Amazing. Thank you.
Of course. You can take a look at try.labdao.xyz to run a notebook in a couple of steps, put it in your wallet if you want to keep the work that you've done. And otherwise, we'd love to hear your feedback.
Absolutely. I think Plex is an amazing tool that pulls together. And I like the idea of bridging that divide between the crowd community, so their ability to raise funds, the tech transfer, which is very important when you have scientists living in the academic sphere, but also involving those scientists as well in that whole process. That trilemma is actually very, very important. And so, as Nicholas said, we'd like to open up the floor for people who may have questions. So feel free to put those in the question and answer or into the chat, and we'll field them from there. But one of the questions that I have is kind of to that triumvirate point. Have you had the opportunity to speak with university institutions in terms of onboarding that? So we know that there is friction as it relates to who owns what, how that works within the current framework of institutions across the world. And what are those conversations kind of been like with you?
Yeah, so our focus has mostly been always directly with the practitioners. What we built, the protocol we built has been very focused on practitioners. So we spent most of our time talking to scientists that actually have a computational biology problem, and we try to help their computational biology problem first. Now, I think, as we keep doing that, and as we onboard tools that computational biologists or other scientists that actually, ideally, scientists that are not very familiar with computational biology, they just want that one thing to work. As we sort of build a product that increasingly brings value to them, we definitely do have to have these conversations with universities too about what these tokens mean. And I'm frankly pretty excited to start having these conversations. I know there are some pilots, for example, in the Max Planck organization with, they call it Blocksberg, where they keep track of, scientific work that's being done and people can register that. But I also think that other university systems would be open to giving their scientists a way to like record the work that they do.
And in your experience, since you're dealing with really that ground community of scientists, what kind of approaches have you guys taken to really get involved, to get plugged into those individuals? Now, clearly this is one where you can help broadcast, but what are some of the others?
So it's really been, what we see on Twitter and Discord, and then we have conversations just with computational biologists, sometimes PhD students, sometimes professors, sometimes founders. Actually, we really like working with biotech companies because they just really test. They have no patience for something not working. So we really, pressure test what we're building. And then I think, however, as a next step, we're, really interested in also talking to universities directly, but it's mostly, people just through the community, contacting us, talking about a project. And it's something that we really enjoy. And I think that that's sort of obviously a benefit of having an active online community like LabDAO and a lot of other communities too.
For sure. And I know you guys have your weekly LabDAO's Twitter spaces that are hosted by Jocelyn and Stanley, and a few other people are there. So that's also a great opportunity for those listening. If you want to get involved and start to talk with the founders and the rest of the community at LabDAO, you should definitely join those. I think they call it coffee. They're like coffee meetups, and those are usually fun. To your last point, I think this will be the last question until we bring up our next speaker, but you talk about biotech and the application of this in that framework. Now that's an enterprise-based community or enterprise-based entity. I assume that the considerations are different between that and those non-enterprise-based entities. And so what are some of the amendments or considerations that you guys or LabDAO has to put into play when looking to deal with those entities that require more level of privacy, more legal sophistication when it comes to this?
Yeah, it's a really good question. One aspect to the exchange that I haven't talked about in this presentation, but that we've been relatively busy with, is the option to basically only broadcast the work that you did through these tokens, but not necessarily use the fully public IPFS system and public compute system, but basically create your own community workspace or your community internal or company internal compute and storage environment. And this gives, I think, both companies, but we hope also these like BioDAOs, the ability to have their own intranet and make sure that they can actually innovate. And while, we might, and I'm definitely on that list where we might not find that particularly thrilling, as sort of, in the context of open science, that I'd rather have that type of like internal science happen on Rails that can very easily, with the flick of a button, be fully distributed. A, and then B, we also just need to understand the sort of realities of therapeutic development and what it takes for a scientific idea to turn into medicine, and being able to like claim intellectual property over your work, is part of that. So we need to build products that respect that reality if we want to really bring like a change.
Yeah, for sure. I think Laura puts it very nicely in the last panel, where we have to go to where we're seeking to. So we do want the enterprise grade because they do form there's a value chain that exists there, and how do we helpfully kind of bridge that divide? And that's going to be a constant conversation and a dynamic change in the policies and the infrastructures that we are making on the ground floor, and coordinating with them to see what best suits them. But it's essential and it's necessary. The point is to disrupt, but not necessarily get rid of what existed before. So with that, we don't have any more questions. Nicholas, as always, it is a pleasure to hear your passion and what you're doing. Thank you very much for the great things. And as a scientist, I appreciate the protein docking and all the biological computational aspects. I tell all my friends about some of these great platforms. So thank you again. Have a great evening, and thanks for coming on.
Thank you for having me.
Absolute pleasure. So next up, we're going to have our our moderators bring up our next speaker. Let's see if that happens. And in the meantime, I will introduce them. So next up, we have Omar El Nagar, who is the CEO and founder of WeaveChain. Omar is truly a blockchain industry veteran with over 10 plus years of product executive experience across fields of data management and AI technologies in both Web 2 and Web 3. And as somebody who's had the ongoing pleasure of interacting with Omar through a variety of different DeSci activities and events, I can definitely say that many entities in the space would not be where they are today if it weren't for him and the amazing team at WeaveChain, which is essentially a layer 0 for data in the space, right? It provides enterprise-ready solutions for entities looking to integrate their stack with Web3 technology. I see Ricardo.
Yeah. I'm trying to bring him in.
Omar.
I have invited him already as a panelist. I just need him to join. Trying to promote him.
All right.
Oh, here we are.
There we go. There's Omar.
Much better. Thanks, guys. And Jelani, what an introduction. Way too kind, sir.
Hey, man, it's always a pleasure to see you. So I will actually leave it at that since you are here and allow you to regale us and speak to us and inform us on how distributed storage plays a key role in, I guess, everything that we're trying to do and how WeaveChain kind of facilitates that.
Well, I appreciate it. I don't know if it's going to be as exciting as protein folding and such, but we're about to get nerdy as always on the data
Let's
side
go.
of things, which I love. Let me start sharing over here. Can you all see that okay? I'm going to assume it's all right. We've done a few of these Zooms before. Well, hey, everybody. I'm Omar, the CEO and co-founder of WeaveChain, and I'm thrilled to be here at SciCon 2023. So thanks to Patrick and the ResearchHub team for hosting this event. And Jelani, I appreciate you inviting me to speak. Today, we're going to be talking about distributed storage, a subject that I'm passionate about in a way that's slightly off-piste from most people. But I figure we'll sort of break things down into the benefits, drawbacks, methods, and examples. So, we'll start with why we even care about decentralization, then jump into how it's actually implemented today, what are some of the drawbacks of it, as well as some examples of who's actually benefiting from this technology today. So let's start with why does the decentralization of data even matter? And at WeaveChain, we're very opinionated on this idea that what we're trying to do is really fight fraud and data abuse. So when it comes to fraud, people used to complain about bots and misinformation. But one of the interesting things is that last year, after FTX imploded, we just saw outright financial fraud come top of mind again, both for FTX, having $8 billion of assets and $10 billion in liabilities, as well as a lot of hedge funds that were exposed to FTX that literally just lied about their exposure and broke contracts for that. Now, in the age of AI, we're also seeing data abuse on an unprecedented scale. I think there's 8,500 lawsuits against OpenAI right now. Everybody from J.K. Rowling from Harry Potter to George R.R. Martin and Sarah Silverman. And the general idea is that, these people had clearly copyrighted material and, these AI are consuming that material and claiming fair use, which is a pretty clear violation of terms of service as far as most people are concerned right now. And the good news is that we can go and address these issues with things like decentralized storage. So at WeaveChain, we always try to say that we're trying to make data flows provable, where we understand the source of data, that it is backed by these cryptographic guarantees of immutability, and that you can see a lineage of how things have progressed. And then we are really promoters of data exchangeability, where individuals can own their own data, exchange it for digital currencies, and that could be for raw replication or for things like confidential computing. Now, let's dig into this a little bit deeper and talk about things like self-sovereignty, right? The ownership of data. And really, this is like the evolution from Web 0, which is, disks by themselves, to Web 1, which was really a lot of individual data silos, to Web 2, which were network data silos and data lakes, to Web 3, where people say we're creating this, cross-organizational mesh where people can really own their own data. And I actually really like one of the things that we worked on with the team over at Genoverse for this, where their vision is to go and enable individuals to own their genetic data and have an NFT that represents access rights to it. And we think of data governance in this case as three different patterns. An individual could actually let Genobank hold their data for them. This is the traditional SaaS model. Or ideally, we create this Geno Vault where I could actually host my genetic data on my personal devices, my phone, my laptop, or even use a third-party steward. So this company, Skyflow, is a very well-regulated data store that can hold anything from genetic data to financial data and everything in between. it should be the choice of users where you want to host your data, right? You should not be forced by, big companies like, Google and Microsoft, not to pick on them, to be the only people that would be the store of your data. You should have these rights. And then you should benefit from all those other properties I told you about earlier, access using wallets and NFTs, confidential computing, lineage. And then if you own your own data, you should be able to go and learn from your own data at any time. One of the interesting things that Dinaverse highlighted was that there was an open source code base for understanding whether you had personal Alzheimer's risk that had to be taken off a service like 23andMe because it was not FDA validated, but it was based off of open scientific literature. As a user, I should have the right to own my own data and study myself based off of these open source tools in a way that's very easy. And I think, the next step of the vision is maybe there's other researchers that want to earn from or learn about my data and are willing to pay me for it. I should be able to make that data available to them in a way that benefits me in a secure way. And I think a lot of people in decentralized science share this vision. We put this together. The team from Reputable Health had this vision of building this Web3 data economy where users would be able to exchange their data for tokens that could be purchased by these data buyers. And the idea was that you would have this mesh of users with data on their personal devices that would then provide access to that data through a weave chain node or another mechanism so that these big data buyers could come in and get access to these data sets. This is, maximally distributed storage, where it's literally at the user level, and you hope to go and create this data mesh where different parties can go and benefit from this data on different levels. This idea has been promoted, but not just by people in decentralized science, but also the team at Vodafone had this vision of not the Internet of Things, but the economy of things. Imagine that every device out there is generating data that's available for purchase at any moment in time in a way that's completely frictionless and really just needs you to say, I am willing to consent to sell this data if you are willing to pay me, and then let the revenue streams come in. Now, moving past self-sovereignty, I'll note that a lot of people in Web3 are big promoters of this idea of censorship resistance, meaning that if I'm hosting my data personally, as opposed to Twitter hosting my data, well, then there's no way that they could just go and take down my content based on a whim, for example. Now, full disclosure, I know that this is something that people in Web3 are very passionate about. I am not as much of a proponent of it because I feel like laws are laws. So, as we saw with the Tornado Cash incident, where we had a fully decentralized protocol running, governments were still able to say, yeah, sure, your wallet is self-sovereign. But if you go and interact with this protocol that we have identified as illegal, I'm going to blacklist your wallet and make it so that you cannot withdraw money from bank accounts anymore using it. I do think that's going to be a case with most of these peer-to-peer services, no matter what. But I appreciate that a lot of the space is very into censorship resistance. More interesting to me is trust through consensus. And I really like this slide that the guys at Chainlink had, last year at their kickoff, where they were talking about this move from paper guarantees to cryptographic guarantees. And this is really what I think Web3 was designed to do really well, is make it so that it's not like don't be evil, it's more can't be evil, right? If I have these guarantees at the data layer, then it's impossible for me to commit financial fraud, for example. And to explain this concept, I'm going to use an analogy based off of this verifiable credential pattern. And the idea is similar to a driver's license in your wallet, right? I go to the DMV, they issue me a driver's license, I hold in my wallet, and I can go and present it to the bar, and the bar can actually scan the barcode on the back of my driver's license, validate that it was issued by a government agency, and that I am 21 or older, and then I get to drink. This pattern is the same pattern that's used for HTTPS certificates, and it was made a W3C standard just last year, and we think it's going to be used for everything. So if we move past the driver's license example, when we talk about HTTPS security, this is what your browser uses to identify that a website is authentic. All right, that little lock icon over here, it makes sure that the website you're interacting with is actually docs.google.com and not somebody who's spoofing that address. And it makes sure that once you set up that communication channel, that nobody can tamper with it. For example, a government agency injecting something into your stream to docs.google.com to present you with something that you, let's say, didn't actually come from the source. But it's using the exact same pattern as that DMV example, right? Google will issue a signed certificate in this case, and then I will validate that certificate. We'll set up a secure tunnel for our activity, and then we'll go and do all of our activity through that secure tunnel. Now, this encryption technology took literally 25 years to reach mass adoption. When it started off, people were just like, it's slowing down my websites, and they hated it. And then, we had a few high-profile breaches. In 2010, you couldn't go to a Starbucks and use Facebook without getting hacked, for example. And in 2013, it turned out like, everybody from the NSA to China was actually hacking these HTTP streams. And we think the exact same thing is happening right now in this migration to, Web3 data and utilizing things like distributed storage. So when it comes to Web3, we say that what we're trying to do is establish a shared immutable ledger. And the problems that we are dealing with are when you have unpermissioned writers trying to write to a database, and when the participants try to tamper with history. And the general idea of most consensus mechanisms is that, let's say A over here is going to go and initiate a write to the network. B and C will acknowledge that A is doing some writing over here, and then they'll all update their local databases, and then they'll go and update a blockchain, which is a way to go and ensure that we all maintain this shared history and that nobody can tamper with it. Now, we think that this is the kind of technology that's going to go and apply to things like scientific research to ensure that people cannot commit fraud for results. So, there was a great review from the NHS just last year talking about how they wanted to go and leverage the power and potential of all this data that they've collected. And one of the key things here was to establish, reproducibility in scientific pipelines. We use these shared distributed ledgers for exactly this purpose, to go and say, I want to go and have this shared immutable ledger of the data that's being stored, the computations that are run, and the results, and make sure that that fraud can't happen over there. And they also talked a lot about confidential computing, which I'll dip into a little bit later. Now, the last benefit that I'll say from distributed storage is permanence. And this is, Arweave's forte right here. They are the permanent information storage service for Web3. But, even if you're going and putting data into a smart contract on Ethereum, for example, you should be establishing permanence for that data, for better or worse. And the cool thing here is that you have services like, DeSci Labs, DeSci Nodes over here, which are trying to go and attach all this metadata to research paper objects. Well, you want as much of that as possible to be permanent and there forever, so that, again, people can't go and tamper with it, and so it's always available for researchers. Now, how are people actually going and achieving these interesting properties of decentralization? Well, let's start with how things were done in the past, right? Let's say that I have some data and I'm trying to sell it to you, the buyer. Most likely, I'm going to go and put that data onto an FTP server or in some demilitarized zone. And then, I can put as much data as I want over there, and you can go and pull it from that location that you have access to. That's okay, but, again, we have none of those interesting trust properties that I mentioned earlier from decentralization. If you're going to go and use a permissionless storage mechanism like IPFS, for example, what you do is say, all right, I am going to go and encrypt my data and put it into this public storage mechanism. In IPFS, everybody can access all data there, but if they don't have the keys, they can't unlock it. So when I have a buyer over here, I need to first go and give them the key to go and decrypt that data, and maybe I'm going to sell them that key, and then they can go and pull the data over here into their local mechanism. This is a really interesting way to manage, public goods, and we're big supporters of it. At WeaveChain, we have a slightly different approach, where we go and let people set up weaves in their local environments for, let's say, their private data sets for healthcare data, financial, you name it, attach their local database to the WeaveChain node, and then go and have their consumers connect to the Weave and then potentially pay to replicate raw data with no third-party mechanism in here, right? It's fully peer-to-peer, where it's me and you sharing data directly with each other in a way that's synchronized. And we want to make it so that you don't have to go and put your data into another third-party service. We want you to be able to connect your existing database right there in line. And same with the consumer. They already have a database. They should just go and connect it to the WeaveChain node locally, and then they can go and deal with fees and paying for data. Now, I wanted to go into one subject that is a different way of accessing data that I still fits into this sort of theme of distributed storage, which is confidential computing. And in a confidential computing scenario, I'm not giving you the data itself. I'm giving you access to the data so that you can run some computations and learn from it without exposing the raw data. So let's say that, I thought there was a really good talk from the head of Walmart's data governance back in 2022, who was talking about how Walmart considers all data that they hold effectively a liability. They know that they are subject to regulations from this data, and they're really trying to minimize how much they have on-prem and making sure that what they do have is actually worth it. And there's new services that are coming up like Skyflow that are really good for actually hosting this data. But better yet is if you don't have to host the data at all, and you can just sort of benefit from it using something like confidential computing. And what we mean by this is, let's say that I am a hospital that has patient data. I can't just go and give my raw copies of patient data to other people. It has personally identifiable health information, and that's just not appropriate. What I could do, however, is tell somebody, I will give you a schema of the data, and you can go and design some analytical process on your side, and I will let you run that process on my servers and give you the results, but not the data itself. And a better way to describe this is using slides that I have stolen from David Aronczyk at BioDAO. David, thank you very much. He was able to describe this really nicely where, org A, again, is that sensitive data holder, org B wants access. Org A is going to go and say, give me your job. Give me the computation that you want to run over here. I will go and look at it to make sure you're not exfiltrating data. And if it looks okay, I will run it against my data locally, create some results, make sure that there's nothing sensitive in those results, and then give them back to you. This is how we actually see future data flows happening, as opposed to, let's say distributing storage rights. And we're really excited about it. This can happen in a one-to-one capacity, as we just looked at, or I could have my my analytical process that I designed and run it against decentralized data sets, right? Where each of these parties hosts the data in a self-sovereign fashion, but makes it available for computation. And there are a variety of different techniques for doing this. Compute to data is what we just looked at, where it's sort of one-to-one. Multi-party computing can do things like a simple algorithm across multiple data. Federated split learning is great for training machine learning models. And then you have things like zero knowledge proofs, Merkle trees, homomorphic encryption, et cetera. Now, this is all well and good for how these cool tools can work, but what's the catch, right? And unfortunately, there are a bunch right now. We are still in the very early days of Web3 storage. And I'll be honest, right now, a lot of these services cost more than if you were just gonna go host data yourself and serve it up. Even services like IPFS and Filecoin, I've talked to the providers that say that at this point, it's like 2 to 3 times as expensive as just hosting things on AWS, because you still need to establish redundancy and you still need to go and make sure that you're paying for that usage. And unfortunately, a lot of the incentives are just not there anymore. Additionally, it's not as performant, right? If you are going to be synchronizing with a blockchain while you're doing all these interesting things with the data, well, that's going to be more expensive than just accessing the data by itself. At WeaveChain, we say that we're about like a 10% performance penalty on top of a database for read operations and 20% for write operations. But if you go further down the rabbit hole towards things like ZKML right now, that's 1,000 times more expensive computationally than just doing things natively. And it's not necessarily easier either. Interacting with IPFS has all kinds of challenges for availability and nodes and things like that. And we're all like very used to building directly on databases at this point. There are billions of libraries and Stack Overflow articles that get up to speed, and that's just not the case for a lot of these Web3 services. And the last one, which is one that I focus on quite a bit, is compliance. So, we used to say that like building Web3 is miserable at best and illegal at worst. We know there are challenges with fully centralized architectures, but when you go into fully decentralized architectures, a lot of times you lose things like GDPR and HIPAA compliance. And so we say that a lot of times these things are best for public goods, things that don't need GDPR compliance because they're already public and available to everybody. And the thing about GDPR compliance is that you need to be able to erase data. And if your ledger is permanent, like Arweave, well, you can't delete things. So that means you can never put data that has to be GDPR compliant there. And same for HIPAA, you need physical safeguards. If I'm going to dive deeper into this, again, the core idea is that public and permissionless Web3 cannot forget. Therefore, you cannot satisfy a GDPR erasure obligation. So if you are the user of a service that wants to, and the users are citizens of the EU, they have a right to ask you to delete your data, and you just can't do that if the data is on Web3. And for HIPAA compliance, you need physical safeguards. You need things like firewalls. Encryption is a technical safeguard, right? That's one of the 3 categories that's required over here. But again, if you have no firewall for your data, then you are perpetually in a breach state. We like to say that Weavechain is the sweet spot of data storage centralization, where we utilize these smart trust networks for data sharing that are private and permissioned and utilize firewalls. So our vision of the future is that most data is going to be in these sort of networks of specialized networks, where hospitals may be sharing data with each other so that they can go and provide better care. Financial entities may be sharing financial data so that they can be more efficient. And this is a way that sort of satisfies the legal obligations of today, as well as the features that we want out of data tomorrow. We call our pattern a layer 0 for data, where we start with, again, these truly self-sovereign nodes that share data with other parties in a private DApp pattern. And that could be a data DAO or even just an individual user running an app in their browser, for example. But these side chains or private dApps are completely isolated from each other, where not one bit flows between them. The way that we achieve the security of Web3 is by actually anchoring our data to layer 1 and layer 2 protocols. We call it like a data rollup for security. And the idea is that I can go and take a one-way hash of data. And what it shows me is that this data will always create this hash. It's a deterministic algorithm. And if I change the data in any way, it wouldn't recreate the hash, and I can never use the hash to recreate the data. If I put those hashes onto a blockchain, then I'll have these timestamps that guarantee that like this data made this hash at this moment in time, and nobody could have written to that blockchain or edited with the order unless they were the owner of the smart contract and permission to do so. Or if they were able to actually hack the blockchain itself, which thankfully is not happening for pretty much all the major networks that you know and love today. So the last bit I want to talk about is who is actually benefiting from this technology today. And I will note that Web3 storage is still very, very experimental. We're in the early innings here. So again, for using most of these public and distributed storage mechanisms, I really think that academia has shown good progress so far, as well as the government public goods, where things like compliance are not quite as big of a concern. We've also seen a lot in media. So, that could be from storage of monkey pictures for NFTs, but we're also seeing the emergence of the use of distributed storage for licensing content. We are working on this very heavily at Weavechain, where we're trying to license data and computation for what we're calling, the Napster moment of most media. I mentioned earlier, large language models are really sucking up a lot of data under the guise of fair use. And I just don't think that's actually appropriate for most of these people that have generated copyrighted work. So one of the companies that we're working with has this challenge where once data leaves its walls, they can't differentiate between what's legal and what's illegal, right? If somebody comes and scrapes their website, how do I tell that that's scraped data versus the data that was acquired through a purchased API? And the reality is that the only way you can protect data on your website right now is with a little file called robots.txt that's like, hey, robots, please do not come and get my data. And the reality is that suggestions are just not an effective defense, right? That file at Twitter says, to every robot that might possibly read and respect this file, please do not scrape my data. And again, it's just not working. So what we do is we go and provide them with a licensed data API that comes with a signed manifest. We're collaborating with the Content Authenticity Initiative that was sponsored by Adobe, and we anchor that data to Polygon so that it's very clear what legal data looks like versus illegal data. And what's really exciting is that we're taking that the next step by then saying, let's go and show what a licensed large language model looks like versus an unlicensed one. Where if we go and run a training algorithm through a Weavechain, what we're putting on the blockchain this time is not a proof of data, but a proof of computation. But again, we are decentralizing that amongst multiple parties and showing how to have these cryptographically secured trust economies. So here we create that computational lineage, we put the proofs on chain, and then it's very easy to show what a bad black box LLM looks like versus a good one. And we think that this is really the future. Senator Blumenthal and Hawley just released their framework for, the AI, US AI Act. And it is very clear that most large language models are going to be licensed in the near future. They'll be subject to audits. They'll be responsible for the data that they trained upon, and they'll have to be including things like watermarks and public registries. Our bet is that today's LLMs are these Napster era black boxes, but really the LLMs of the future that people are using are going to be these massive ones. Another place where we're seeing decentralized storage working a lot is in finance. So one of the coolest case studies that I've seen was this consortia of over 100 banks in Italy that are deprecating trade reconciliation processes using distributed storage technology. So the idea is that, like, if I'm a customer of, let's say, Goldman Sachs, and I go and execute some trades with them, and Goldman Sachs is actually interacting with JP Morgan for those trades, at the end of the day, Goldman Sachs and JP Morgan will have to go in and share a bunch of CSV files of trades with each other to make sure that their books match. Instead, if they were just using one decentralized storage mechanism for those trades, then there would have to be no reconciliation process. And theoretically, you would have massive efficiencies gained by this. At WeaveChain, we work on a solution for verifiable financial data that does things like proof of reserves or proof of solvency, as well as proof of custodianship for this data. And the challenge here that we were facing for a lot of these hedge funds is that they did not want to use Web 2 SaaS solutions. So Credora is a really cool service that's actually using confidential computing in a cool way. The problem is that they are a SaaS service. And so the only way a hedge fund can use them is if they say, okay, Credora, I'll give you my private keys so that you can go and download my position data to your servers and create a report based off of this. This, unfortunately, is puke-worthy for most people in finance. I ran R&D at a hedge fund. We didn't use AWS. Like, we hosted our own data centers so that nobody could go and see our position data. And if you're doing a public DApp, again, we're saying maybe it's okay if you encrypt your data and put it on IPFS. I don't think so if you're a hedge fund. What we say is, let's do this in a peer-to-peer fashion. Our private dApps have no data on them. The hedge fund actually hosts a WeaveChain node with its own database locally so that it can load its positions through the WeaveChain node into its local database. And when it creates a report, it shares it peer-to-peer with that lender like Maven 11. And Maven 11 can go and receive these reports peer-to-peer across all these users in a way that is, decentralized, but again, trusting no third party, none whatsoever. In this model, we really think it's all about, like, who is that trust network? In this case, it's, hedge funds, lenders, and people like fund administrators or credit rating agencies. You're always going to need somebody who can go in and see the data in a raw format, because the problem with proof of reserves when it came to FTX was that they had a surprise $10 billion liability that they hadn't told anybody about. You need humans in the loop for that part. You also need humans in the loop if you're going to utilize zero-knowledge proofs, right? A zero-knowledge proof is only useful if both parties have the raw data and then are using the ZKP to check each other. The last use case I'll mention over here, which is particularly useful to DeSci, is healthcare. And full disclosure, I think this space is also still pretty early, but we're excited about, the marketplace that we built for Genobank, the Genoverse, where you can come with your bio NFT from Genobank and then go and click on a bunch of these services and learn about yourself using confidential computing, where I can see the results of my heart disease report and nobody else can, not even Genobank. We did a lot of fun things with them with ChatGPT. It was all cool, but again, it's early days. The project that I'm, full disclosure, most excited about is Data Lake. They have partnerships with the government of Poland, the EU, and they recently did a partnership with Novartis that I'm thrilled to see materialize. I really think that this is where the space needs to go, is merging the principles of decentralized science with traditional science practitioners that can bring a big budget to bear and get the best of both worlds. I know I covered a lot today. We went through sort of why this matters, how it's actually implemented, what are some of the drawbacks, and who's benefiting from today. But it's really an exciting time for this space. And of course, anybody's welcome to reach out to me. I'm Omar Alngar on Telegram. I'm in all of these Blockchain for Science chats and DeSci World, and you're always welcome to reach out with an email anytime.
Amazing. Thank you, Omar. I think that was a very, very comprehensive look at the opportunities and also limitations that exist within the distributed data storage solutions, I guess, that exist right now. I like that you broke it down per industry. I do think DeSci is largely focused on the healthcare industry, but that's subject to change. So things like considerations of not really needing to mind GDPR and HIPAA and bringing in fields and disciplines and industries that don't have those considerations, it's almost more catered to that. And we're kind of starting from the ground up through the difficult pathway, but it's still very interesting to see. One point that I think keeps coming up in my mind and having the pleasure to go through this industry or go through this this space is that we often talk about like data silos, right? And how Web3 is, I guess, in theory, or at least the ethos is to get rid of data silos or is to help bridge the gap between data silos. But if you think about it, or at least if I think about it, if you're going to give every individual data provider or data generator a specific key which allows them to exclude other people, you're now creating small but consistent data silos across. And so how do, from you as a person who's very pragmatic, deals with enterprise, like how do you see that reconcile with the Web3 ethos? And just disclaimer, DeSci leverages Web3 tooling, but I think DeSci as a concept exists beyond that. It even exists beyond a variety of different frameworks that we're presenting here. But I'd love to kind of get your perspective on how do we reconcile that? Are we effectively creating just smaller data silos? And are we going to see things where prices to access get ramped up because each individual is like, oh, this person is charging more, I'm going to charge more, and it just keeps scaling?
No, it's a great question. And, I have this conversation oftentimes, weirdly enough, with my wife, and I talk about partial progress being okay. And it's like, it's very controversial because especially in Web3, you have a lot of people who are sort of maximalist about these things and saying that, look, if we're going to go and do it, it needs to be fully public and permissionless, decentralized from the start. And we'll figure out how to make that work. But that's, again, like a hammer in search of a nail kind of thing. So like my perspective is, again, the goal is let's go and take one silo and let's go and figure out how to bridge that across 5 hospitals to start instead of, every hospital in the world. And if you do that, you're doing a really cool thing. Like you're making it so that, what Data Lake is doing with their consortium of hospitals in the EU is really effective at data sharing. And it's a lot easier to sort of add people onto that bubble as it starts to grow. And I think that comes back to my point earlier, which is there is a middle ground over here where you are not fully centralized and you are not fully decentralized. You are sort of dealing with the requirements of the time to make progress towards it. And I think that's how we're going to do it. So again, it's a sort of land and expand and attach as opposed to just rip and replace and be sort of hyper idealistic about it.
Cool. One thing that I hope to see, and I'm sure, well, you can actually let us know if you see that in the framework, but one of the biggest issues that we have from this data siloing or this lack of interoperability is not a intent-based issue, but more of a lack of standards that exists between players, right? So a lot of it is really unintentional. And it's just that the way that I have my file structure or file format it's not compatible with how you have that. And I imagine things like Weavechain, and when we start to create, and what Data Lake is doing, and what Genobank is doing, is you're creating these frameworks where players are not necessarily incentivized, but start to play with one another. And I hope that the goal moving from that is that we start to have these conversations where we can, and especially when you have decentralized or federated learning, distributed computing, where you have that like assuredly where you own or you maintain sovereignty over, or the entity maintains sovereignty, we can start to have this shared standardization or this generation of just a global standard in a particular industry that can help further facilitate that. Is that things that, yeah, so I know that's a goal, and personally in my endeavors, that's what I would love to see. Have you seen some of that coming to the forefront? Is there conversations that exist around that within the field of distributed storage that is, kind of showing or giving an inkling that it's maybe going in that direction?
100%, but and that one, it's almost like more about the standards themselves than it is about the mechanisms for using it. So I'm part of a committee with Keith Comito, where we're trying to go and establish standards for how you actually do like device level standardization of data for measuring, Alzheimer's treatment and things of that nature. I'm doing a talk at the AIMA on sort of like blockchain and data sharing on these things. But for all these, it like comes down to, are you going to figure out how to, just get people to use things like FHIR standards, things that already exist. Again, I think what Data Lake is doing is really special in that regard, because they have connected to like 200 different hospitals in the European Union and created a standard for themselves that they can do it with. So it's going to be a long slog to go and get these things to happen, but it is happening. And I would just say, like, separate out the interface from the storage mechanism as much as you can. Like, it comes to, for us at WeaveChain as well. We really try to say, like, I will go and let you use whatever storage mechanism you want for this data. It could be IPFS, it could be PostgreSQL. I don't care, but once it comes to this bubble, the interaction between them need to happen through a FHIR standard or something equivalent to make sure that again, we have the potential to scale when it gets there. Because at the end of the day, you remember we did this talk at DeSci Denver. It was like, why does interoperability matter? That's how you get to internet scale applications, and we want to see this for things like healthcare as well.
Amazing. Well, I have a few questions, and I'm sure other people will as well. So if you do, please go reach out to Omar himself, interact with the WeaveChain community. As you can see, it's very nice, very, very approachable individuals. And yeah, you can learn a lot. So Omar, again, thank you so much. It's always a pleasure to see you, and I will see you at our, next event where we converge. Have a great rest of your day, man.
Thanks, Jelani. Thanks, everybody.
Take it easy. So next up, we have another great talk, this one now by Dr. Nassim Dahouch, who is the founder and developer of SciDex. So Dr. Dahouch holds a PhD in computer science from the Paris Dauphine University and a state engineering degree from Huari Boumediene University of Science and Technology. He has authored some 20 plus publications on topics including decentralized science, peer review, and AI, and has been actively deploying his expertise in these fields by advising startups and institutions in the domains of crowd labor, smart contract security, incentive alignment, social graphs, decentralized healthcare, and more. Most recently, Dr. Dahouch has been finalizing the launch of SciDex, which is a very exciting framework, which is a platform that essentially allows and empowers DeSci and domain expert DAOs, like what we saw earlier today, to kind of effortlessly launch their own peer-reviewed academic journals. And so I myself, and I'm sure the rest of us here, are extremely grateful to have Dr. Dahouch here with us today, and we'll all be happy to understand or to participate in his topic of on-chain peer reviewing, as I'm sure all of us can, especially the ResearchHub Foundation and community can understand that peer reviewing is at best broken, I guess, as we can claim it, a nice way of putting it. And so without further ado, Nassim, it's a pleasure to speak with you again, to see you again, and thank you for your time.
Thank you very much, Jelani, for the invitation, for your kind words. Before I start, just a disclaimer, I caught COVID 2 days ago, fortunately, and so I apologize in advance if my brain's a little slow and my voice a little nasal. So I have no idea how I sound. I'll try to do my best anyway. And keep the presentation not just about SciDex as a tool, but really as general as possible about, as you have said, the brokenness of modern publishing, and also how we can solve it with or without blockchain. So if I may share my screen. Here it is. Just make this full screen. Sorry, so many pop-ups, it's hard to find the full screen button.
I think it should be at the bottom right. That's where I see it.
Is it?
Might be.
Bottom right. Well, exactly, thank you.
No problem.
So I think we can all agree that modern publishing is broken. We have all seen the memes. We have, I'll go through that quite fast. we have this basic problem of incentives, which is that both the production of content as well as its quality control is performed by highly skilled experts for free, and we even have to pay to do it. So the memes that academic publishers make you pay thousands of dollars to host a PDF are true to some extent. We can keep them as, an actionable basis for discussion. But later we'll also have to say some nice things about academic publishers, because there is some value they bring besides, just hosting the PDFs. But as a starting point, it's a good one, I think. In fact, one thing I've discovered while making a sort of research for SciDex is that the system itself was invented by Robert Maxwell, which is the father of the infamous Gillen. And so it is a vicious system at its root. We have all seen, the super predatory recent publishers like MDPI, who publish thousands of not articles, but special issues per year. And there is also a problem that we have to solve of incentivizing people to review papers. So even the big publishers nowadays are having trouble finding, reviewers. And one concerning development because of this is that people are seeing more and more undergrads review papers. So I don't think that's a good solution, and that's another thing we need to address. And so this leads to huge delays for authors when they submit their papers. And so all these are problems that have been around for years that are becoming, more and more acute. And there's also a problem that the papers are not actually made to be read and to have an impact, but mainly to be cited, to act as KPIs for your performance as a researcher. And so there's also a problem of readership for these papers. And of course, there's the problem of replication, which I do not address myself, but I've seen some very interesting work being done around it in DeSci. Now, is blockchain the only solution? Is it even a solution? Not necessarily. I should mention that some classic solutions that exist have solved all these problems, notably the problem of incentives for reviewers and for editorial board members. One of the most prestigious journals in my field, Combinatorics, is this one, the Electronic Journal of Combinatorics, which has been around since the 90s for more than 30 years. It's a very prestigious journal, very serious, owned by its editorial board, as you can see. And it's a not-for-profit endeavor. So it is free for readers, free for authors, very, sane and virtuous system. But it may have a problem with its economics model because it is sponsored by universities providing hosting and tech, but there isn't much, income being generated. And so you could say that this is funded by the children of the editorial board members who pay in not seeing their parents. So there is a problem of profitability here that we may address. And there's also a very interesting solution for the problem of finding reviewers that was quite popular in the mid-2010s. It was active from 2011 to 2017, called Peerage of Science, created by a scientist, which is a service that outsourced, Web2 service that outsourced peer review for big publishers. And you see that they had contracts with all the big ones, Springer, Taylor and Francis, BMC, Elsevier, etc. So this goes to show that these publishers are typically open to new solutions, and they support them if they are good. And this was a good one. They had a rather complex, I would say, model for the incentives of reviewers. They did not pay them, but they had a system that which stated that if you wanted to submit a paper as an author, you needed to perform some reviews. some, again, rather complex system for setting deadlines for both authors and reviewers, which may explain the fact that they struggled a little bit to scale it. And they only had 102 submissions in 2017, and that's the year they decided to close the service, to discontinue it. But the system itself was, again, a good one, virtuous for the problem of finding reviewers. And this idea of outsourcing reviews is also an interesting one. So there are Web 2 and even Web 1 solutions to these problems. But I do believe that Web3 blockchain offers better technical solutions for three particular aspects. The first one is acting as a ledger of record. And this is something that you don't even need a user wallet for. So this is something that publications, journals could take care of by themselves, independently of user interactions. I'll show some examples. And then if we increase the technical requirement and sophistication from expected from users a little bit and expect them to have a wallet, blockchain also offers better solutions for identity management and access control. I'll show some examples as well. And even further, payment processing. So Silex as a whole is a full stack solution. So that includes both the smart contracts to handle all these aspects, as well as the front end and back end, written with as little dependencies as possible. So for the first aspect of record keeping, one thing I noticed, and I may be wrong about this, but it seems that the digital object identifier system, the DOI system, is really a poor man's version of what NFTs are, because it's supposed to be immutable, but it's in fact just a URL, traditional centralized URL in a server somewhere that points to a publisher's, content, a publisher's URL, another URL. So two possible points of failure, and the most basic way we can integrate, on-chain aspects in a publication would be to have either on top of a traditional DOI system or as a replacement for it, to have a more serious and actually immutable DOI system based on NFT. So this is a format we have written, a novel NFT format that not only is immutable because the PDF would be stored in IPFS, the NFT would be written on chain, but it can also store richer metadata than traditional DOI. So you can have the review comments stored as part of the metadata of this, on-chain DOI. You can have timelines, which are important as well to know how fast a journal is. That's a very important aspect for authors. That can be tampered with, by editors. Sometimes they are not very transparent about these aspects. So you could have, again, a ledger of record for the events and milestones of the processing of that paper, all stored within this NFT. And further, we also allow to monetize these NFTs, which represent accepted articles for publication, through the Ocean marketplace. Ocean is the funder of Silex. So as part of the integration, we have used the compatible formats to their NFT and token, format, which they typically use for data sets and algorithms. And so we thought, why not extend it to also manuscripts? So the DAOs that use Silex to launch their own publications could sell their articles through the Ocean marketplace. So that's the most basic way in which we can integrate on-chain. Further, if our users have a wallet, the blockchain also offers great solutions for identity management and for ownership. First, there is the fact that reviews can be permissionless, so it's not editors selecting reviewers, but reviewers having incentives to participate. And here, a requirement, which is kind of a difficulty for all DAOs in which we are trying to integrate SciDex, is that you have to perform manual, KYC process to verify that these reviewers have the minimum qualifications to be able to review. For example, in MedDAO for medical peer review, it's rather straightforward because there is a centralized database for all, at least for all US medical doctors. So people send you, a selfie with their ID, and you check their qualifications in this database, and then you emit an NFT representing their qualification. So once they pass this check, any reviewer can review any paper. And we also incentivize the fact that we try to make the number of reviews per paper balanced. And so one mechanism we have used is to divide the publication charges paid by authors equally among all reviewers. So with this, you end up with an equilibrium situation where all papers have pretty much the same number of reviews. And of course, wallets, Ethereum accounts allow for anonymity while we can ensure qualification through these KYC processes. So this is another, again, more technically advanced way in which we can integrate the blockchain. And once we have this, I think the main and most important value that could be used, for example, by the combinatorics journal have shown, would be for payment processing in a decentralized way again. And here you can represent ownership. You can automatically share, for example, article processing charges among all reviewers, which again solves the problem of incentives. And there's also the permissionless aspect that is important, because if you launch a journal, for example, in North Korea, about advertising where it is not frowned upon but completely illegal, you would have most likely some conflict with the terms of service of your payment processor, just like you would probably in North America if you launch a journal about Alexander Dugin and his thought. So for this, and again, if we require a level of sophistication from our authors where they have a wallet and they know how to use it, the blockchain is unbeatable to be able to get any ideas out there, no matter how controversial within our jurisdiction, which aligns well again with the international nature and borderless nature of research. So these are the three levels we can cover with the full version, if you will, of SciDex. But for the integrations we have a spectrum, in fact, of how on-chain these are. For perhaps our most mature integration, which is the blockchain law journal, currently located at blockchain law, here it is, blockchainlaw.org. So here we just use the most basic kind of on-chain capability, which is as a ledger of record. And of course, it lies well with the topic of the journal. We have a very nice...
Nassim, sorry to interrupt. Yes. Sorry to interrupt, but just so we're only seeing the presentation and not the website.
Oh,
if
sorry.
That was your goal. You might need to change a tab.
Thank you very much, Julia. Absolutely. I wanted to show the website. I need to figure it out. My little brain fog, it's not, here it is. Thank you very much. So now it should be working, is it?
Yes, it's working now. Thank you.
Thank you. So this is again the most basic form of integration that we can have, which is to use, as I said, NFTs as a sort of actually immutable DOI. So we use the NFT format in this journal, which is about blockchain law. So we have a very nice editorial board of specialists from Yale, from many crypto firms, So as a side note, if anyone is interested in blockchain law or would like to provide industry insights as well, please reach out to me. I will introduce you to the two the chief editors of this journal, and would be very happy to have you part of this journal. So this is an example of an integration that is at most basic level, again, as a ledger of record for the articles. More advanced, at least from a Web3 perspective, integrations. We have the one with LabDAO. Here, the idea is to outsource medical peer review for medical journals. So they use the system of KYC to determine the appropriate medical specialty for reviewers. And then it's an exchange, a decentralized exchange, hence the name SciTex, of authors submitting their papers. So this is similar to ResearchHub Science, authors submitting their papers, reviewers. So I can show you quickly how it would work. So I can submit my paper here. I can review other people's papers. And then the mechanism I've explained where article processing charges are divided equally among all reviewers. So here we are using the two other capabilities, which are access control for reviewers. And here is another example, which is this fictional data science journal for Onchain. This is not an actual project that's going to be done, but same principle. So access control for reviewers, which opens reviews to anyone who is willing to provide them, and also payment processing. And so this shows something else I wanted to highlight, which is that you can customize the basic, the basic code to your own style, branding, etc. You can even change. Of course, it's very simple HTML, so you can even change the components and everything. And I'm also working on a wizard tool where DAOs can launch their journal, in a few clicks without having to see any code at all. So no code, SciTex is coming soon. All right. Let me go back to the slides, and I hope I'm not taking too long. It's hard to evaluate time. Jelani, how many minutes do I have left? Just so I can.
You are going until, I'm sorry, 55. So you have 10 minutes.
All right, cool. So I wanted to get to, besides some other integration projects we have of things that may or may not directly relate to academic peer review. I just mentioned this interesting project I have with a group of psychedelics researchers, where we use SciTex both for a journal, Acta Psychonautica, but also for a platform where psychonauts, people experimenting psychedelics, can report their experience and monetize their data. So this is SciTex. Beyond that, I wanted to mention a few points about onboarding normie authors, because I've heard some very interesting discussions in the panel today about legacy institutions. Should we replace them? Should we do better than them or live beside them? When it comes to academic publishers, they are really providing a value in terms of the discoverability of research and its search engine optimization, how high it appears in Google. That's something that even the best of us in DeSci, even ResearchHub, which is at the forefront, it is not yet capable of doing. And that's something I talk about freely because I discuss these points very often with Jeffrey, notably from ResearchHub. So this is one aspect we should really make efforts in, SEO, and it takes very simple, steps. For example, you have noticed that when authors publish articles, universities make press releases. And these are not directly responsible for discovering the articles, but they boost your SEO. When it's a link coming from a .edu website, your article gets appears higher in Google. Same for blog posts, which is something that is also encouraged when you publish an article. So this kind of traditional practices, I think, should be adopted by this side. And now when it comes to the publishing platforms themselves, for example, any journal built on SciDex, there is a hierarchy of indices, indexing services. And for most people in my institutions, myself as well, most researchers I know, they wouldn't look at the journal if they are invited, for example, by email, if it's not indexed in Web of Science. So this is, an absolute requirement for submitting to a journal if you wanted to count, because we function mainly based on KPI, institutional research. So this is an absolute requirement. To get there, well, there are a few degrees of indexing. The most basic and easiest, in fact, is Google Scholar, which only takes some specific formatting of the HTML pages, where the abstract and authors and references have to appear before you access the article. So this is very basic, something we should really target in design general. Next stage, which is a requirement for Scopus, is to request an ISSN. I don't even know if ResearchHub has it, but that's something we are requesting, for example, for the blockchain law journal. Again, in theory, it's available to anyone. You just have to request it. It takes some bureaucratic work, just like all the other indices, but that's also something that helps a lot, both in discoverability as well as in accessing the indexing services. And then the thing that will make researchers come are indexing in Scopus. Easier than Web of Science. So they have a set of criteria about the editorial board, about the ethical practices you mentioned in your pages, etc. Very simple, but kind of bureaucratic kind of guidelines to follow. Someone has to do it. And then Web of Science, which is really the top of these generalist indexing services. And then, of course, you have more specialized services, and you have services by country, etc. But this is really as good as it gets in terms of generalist services that gives you access to an impact factor, etc. Well, they have the same kind of criteria, but more rigorous. So I think this is really something that can help attract traditional researchers and researchers in general. It's that some publications in this side get at least some of these indexing services. Another thing that can help is to abstract away the technical complexity of a wallet. There are many good solutions right now. The one I like personally, which I have no financial connection with whatsoever, is Privy, which is really the tech behind Friend Tech, the very popular social fi service right now. That's Privy. So I encourage everyone to check it out if you don't know about them. They abstract away all the difficulty of private keys, etc. And if you want to keep it, you can keep it too, but you can replace it with email, phone number, Twitter account, etc. Magic Wallet and Coinbase Wallet do the same thing, but my subjective opinion was that they weren't as seamless. So that's another point. And quickly, the last point. There's also some work to do in influencing policy. That's part of the reason why we have created the blockchain law journal. In that, we need to influence institutions to recognize the work we do in DeSci, especially for people who have one foot in both DeSci and traditional science. This should be part of the KPIs. So the example I always give is that if I review a paper for MDPI, that counts as academic service in my traditional science institution, but any work I do in DeSci, since it's not part of the indexing services, wouldn't count. So there is some work to do in influencing policy in these institutions. So I hope I was clear-ish, despite the brain fog of COVID. Symptoms are not too bad, but it's kind of, sometimes you lose focus. Anyway, if you're interested in creating your own publication or joining the publications that I mentioned, or if you have any questions about DeSci whatsoever, please get in touch with me. I'm Andosh on Twitter. These are the socials of SciDex specifically. And that's it. Thank you very much.
Amazing. Thank you, Nassim. That was quite an in-depth presentation. I think we touched upon a lot of cool things. And as a matter of fact, and again, the audience, if you have any questions, please feel free to put in. I know for me, the biggest question / concern that I have in the realm of publication is, I think it's great that we have these technologies that allow more participants to come into the playing ground and even devise novel incentivization structures that, you know, can leverage crypto, don't necessarily need to leverage crypto. But I think it's going in a good direction. But I think fundamentally, the biggest shift required is a socio-psychological shift, right? So to your last point, the idea of needing reputation, right? Of people defaulting to, well, if it's in Springer Nature, then it's good. But if it's not in Springer Nature, then it's not good. And the inability or the lack of recognition of what occurs in a more open framework like DeSci to be packaged into that is a huge issue. Nobody's going to want to start publishing in the MedDAO journal, as an example, if it doesn't translate to an H score or anything that impacts them. And so I'd love to kind of hear if there are any insights yourself. You wrote a beautiful paper with a bunch of participants, well-known individuals in the space. So you've been at it from the core for a long time. Any particular insights you might give in terms of what do you think are the best ways to help shift that cognitive awareness? How can we start to make it such that my collaboration contribution to DeSci is recognized by peers?
Yes, I think there are two things at play here. What I mentioned regarding reputation, regarding the indexing services as well. I've called it generalist. You may call it NPC approach as well, which is to follow KPIs. Of course, most of the incentives are there. But in science, there's also something we all enjoy. That's really why we are all here. It's to talk to smart people in small groups, you know, get interesting ideas out there and share them. So that's also an aspect that, you know, powers many publications. That's why I mentioned the electronic journal of combinatorics, but you find even smaller, you know, publications that have their very faithful readership, very faithful people who publish there and like to share ideas and discuss. And that's another format, another model for the kind of publications we can create, which are, you know, tightly knit groups like this who can have their outlet for getting ideas out there, no matter how many people read them at the end. Now, when it comes to practical steps in which we can onboard people in line with this idea, both types of people, both the journalists, researchers following KPIs, as well as this kind of groups, I think nothing beats physical presence in conferences, in seminars. I'm trying to do a few here in Thailand. Whenever possible, for example, to MedDAO, I've recommended a tour of all medical schools because myself, I've been in crypto since 2017, 2018. I've learned about DeSci very late, many years after that. It took some actual prestige and institutions. I am an NPC, just like all the researchers. So it took Sarah's paper, Sarah Hamburg, in Nature. It was around the pandemic where many people talked about, you know, the donations from Vitalik to research, etc. And that's what it took. I didn't take it seriously. I was hearing about, you know, things being done, but I just didn't take time to go through it, etc. So sometimes all it takes is someone to present, compile information to you, and that's it. But again, I think nothing beats traveling to people and visiting them in their institution.
Absolutely. I absolutely agree. And with that in mind, thank you very much for taking your time to, though you being sick, coming to us and providing us this package of information that is recorded, will be around. Very much appreciated. So Naseem, go take care of yourself. I'm sure it's very late or very early actually in Thailand. So thank you for your time, and we'll be in contact. Take it easy.
Bye-bye. Take care.
I see you in the chat, Luca. Hi, Luca. Can you hear me?
Very well.
How's it going?
Going great. What about you?
Yeah, really good. Thank you. Thank you for coming to speak at SciCon. Really, it's really a pleasure.
In contact.
Likewise. Thanks for inviting me.
Okay, so I'll give a little intro to Luca, and then I'll leave it to you to your presentation. So Luca Foschini, President CEO of Sage Bionetworks. Previously, he co-founded Evidation, where he also led, it was chief data scientist for more than a decade, leading a team of more than 50 health data scientists. He worked with several organizations, NIH, DARPA, BARDA. So I would really say that he influenced the health and data scientist profession. His expertise spans across several fields: machine learning in healthcare, continuous self-monitoring, but is really centered on digital medicine. And he's authored many papers in the field and has worked with so many prestigious institutions like the FDA, NIH, the National Academies of Sciences and Engineering. And I would say, from a personal level, had the pleasure to meet Luca, and I can guarantee that you'll have a really pleasurable experience in hearing his presentation. That said, Luca, I'll leave it to you. Again, really excited to hear what do you have to say about open data today?
Yeah, you're setting the expectation pretty high there, and I can't even share the screen. So
well, let me give you a host privilege. Give me a second.
Okay. All right, this looks good. Sharing my screen. Should be seeing it now.
Yeah.
All right. So for the next 20-25 minutes, I'd like to tell you a little bit what we have learned at Sage Bionetworks. I'm going to tell you in a second what Sage is, about open data, basically sharing data, mostly biomedical, and how open is not enough, how we come to learn that, and how I've come to learn and internalize it from my dual background. I'm trained as a scientist and as an engineer, and I transitioned to health, as Ricardo was saying, around a decade ago when I started Evidation. And so I've been in the shoes of both producers of biomedical data, like Evidation does, mostly patient-generated health data, wearable sensors, and EHR and clinical data. But I'll be talking about genetics today. But I'm also a user of that kind of biomedical data as an AI researcher and engineers. So I'm seeing the struggles from both worlds, and I'm seeing a gap between these two roles of producers and users of data. So without further ado, let's get started. Sage is a nonprofit based in Seattle, around 120 employees that started in 2009. Again, I've been president only for a little more than 8 months. I took office in January. And Sage was started because we feel that science could be doing better, could have a higher yield of conversion between discovery and translation, whatever comes out of the lab and makes it to the hospital. And this is a great paper from the Lancet in 2014 that kind of dissects the reason why things don't translate as well from discovery to bedside to translation. And the rough rule of thumb that's given in this paper is that of only 15% of discovery of things that are being researched at the very early stage of a pipeline actually make it into something that changes the life of a patient at the very end of the translation spectrum. And that's not because of the intrinsic nature of research, right? Like research by definition, you look at things and you don't know where they're going. So some of those might not turn out into anything. Here we're talking about discoveries. So things that are positively seen as potentially beneficial that just don't get translated because of lack of efficiency, because of lack of clear definition of what is the problem needs to be solved, and having patients sitting at the table when the definition is being created, because of analysis that are lacking the basic methodological standards, and therefore are even not reproducible. And you can see that each step of this funnel cuts out a little percentage of potentially translatable discovery that never make it to fully translation. And if that was the state in 2010s, the state in 2020 has not changed drastically in terms of outcome. Still, a lot of discoveries don't get translated, but the why, the how that happens, the flavor of why that happens might have changed slightly. And I would posit now in the 2020s where we are witnessing more of a reproducibility crisis than the other reasons that were outlined in the Lancet paper that I outlined before. This is research from my group. On the left-hand side, we'll look at the reproducibility of machine learning for health research across very basic baselines, like is the code even released? Is the model tested on more than one data set? Are there variance or some sort of error metrics around point estimates? And along those metrics, we pit machine learning for health against more mature fields of machine learning, such as NLP and computer vision. And we saw that invariantly machine learning for health is less reproducible. And that's kind of scary, right? Because when you're thinking about a model that's used in healthcare, you would think that it has a higher risk and therefore it should be more reproducible than other stuff that comes out of research. But machine learning for health is less mature than other more established machine learning disciplines. So it's not too unexpected from that lens, but it's still quite unsettling that that's the case. On the right-hand side, you see an even more recent work from my group that looks specifically at models to predict COVID from wearable data, which is something that was all the rage a couple of years ago during the pandemic. Everybody was looking at their Fitbit and say, hey, my Fitbit is telling me that I'm sick. So there's a lot of model building that has gone that has happened across many academic institutions over the last few years to both predict COVID or flu based on your wearable data. And unfortunately, a lot of those models are not reproducible. The performance that is cited, is mentioned in the paper, is all over the place. It cannot be explained by dataset differences, at least for the way datasets are described in those papers. And if you actually plot performance against the density of the positives in the datasets, like how many people had COVID in the training set, you see a wide variety, a wide range of different performance at the varying of positive density, which should not be the case because AUC should be independent as a metric from prevalence, but it's not. And so what really this is highlighting is that there are confounders in these data sets that are not being explained. These are really just different definition of COVID that different groups are looking at. And they're just not captured or annotated correctly in the data sets. And so the models that we're developing that we think are detecting COVID are, detecting different kind of severity of COVID that we don't even know how to measure and to compare to each other. So if in 2010, the lack of translation came mostly for the inability to bring the right stakeholders at the table when research needs to be designed and then translated. In 2020, maybe the main culprit is really that the methods that are being developed and the data sets that are being shared are not properly annotated and curated in such a way that different teams can achieve the same results. So that's why SAGE was born, and that's why SAGE continues to be around. It's really to help the scientific community, mostly in the biomedical and health field, to collaborate, share methods, best practice, and really share data as well. We built a platform called Synapse. You can find it at synapse.org. That has supported more than 2 petabytes of biomedical data shared across more than 12,000 research projects over more than a decade. What we have found is that it's really important to coordinate data sharing right at the beginning, the data producing step, in a very processized way. So we work mostly with academics. We work mostly with researchers that are funded by NIH, the National Institute of Health. And the data they might produce could vary from sequences of genomics or proteomics or RNA-seq to histopathology or pictures of slices of brains in the case of our Alzheimer work. And this data is collected by multiple groups and needs to be harmonized and needs to be curated in the same way, annotated, have metadata that's consistent across all the groups. And really, the ability to make it openly available to the community is not just a technical problem, it's a social technical problem. You have to build a community around the data sets at the collection time, and you have to think about collection and reuse at the time of collection. So we're creating a playbook that we'll be sharing with the community on how we coordinate this data coordination centers, as we call it, as NIH calls it, in order to make sure that everyone is bringing the same type of data to the table, the data is interoperable with each other, and it's annotated in the same and consistent way. But we've seen that even that is only a necessary but not a sufficient condition for reuse. Yes, you can have a great warehouse where everyone that's a data contributor follows the same schema, and you've created a community around the data sets such that every different labs that's contributing data to that data set is using the same way and knows about each other. Great. That doesn't still mean effective reuse. That most of the time means that the data is only reused by the consortium of people that collect it. And so what we've created over time are portals, are way of making that data more findable, accessible, interoperable, and reusable. FAIR, I'm sure you've heard this acronym many times over SciCon in the last couple of days, through data portals. Data portals, we'll create a different one for different therapeutic areas. And those that really have helped us engage a community around a disease or around a specific, kind of data, mostly associated with a specific disease. I'd love to be able to present you with data that clearly show a causal impact of building a portal in terms of increased reuse. I don't have that yet. It's actually part of my goals in my tenure, being able to measure that in a more precise way. But I can tell you that if we look at one of our longest lived portal, which is the AAD knowledge portal for Alzheimer's disease, and you observe the pattern of data reuse from the very beginning, the first few years to the latest years, you can see that at the very beginning, the people that were using the data were just people around the consortia, as I was saying earlier, people that collected the data were also the one reusing it. But later on, the ratio switched, and more than 2/3 of people reusing the data, downloading the data, were people from outside the consortia. So this is not a controlled experiment. We don't know what the world will look like if we didn't have a portal on it, but I do suspect that the portal really has unlocked ability to bring that data outside of the community that generated it, which I think is a necessary condition for effective reuse. Portals are a good step in the right direction, are a good realization that just open is not enough, but they're not the end of the story. I think they are, again, a wake-up call that make you understand that, yes, you can curate data, make it open, make it shareable, but that doesn't mean that people are going to reuse. You actually have to actively bring it to the community that's interested in the reuse, which most of the time is different, has different knowledge, different norms than the community that generates that data. If you don't do that, then you don't see effective reuse. And physicists in the upper left side of the slide know this already. This is a paper from 2018 of how physicists from CERN have learned that in order to really create effective reuse, you need to not only build data, but also tools for elaborated data and really think about reuse from the get-go. And then on the bottom right side, you have a very recent paper from the MIT group of Lee Antonio Cheli that looks at data reuse specifically in the biomedical community and calls out what they call open data in appearance only. Open data a lot of time is called open, but it's really only just openly visible. And in order to access it, you need to talk to someone. And in the case of Sage, we're guilty of this too. You have to, most of the time, talk to the governance team of Sage because the data, being health data, might have privacy issues, so cannot be made just downloadable to everyone. The problem is that this governance step, most of the time, is actually put in place almost in a strategic way for people that don't like their data to be reused or don't like them to be reused so swiftly by everybody else and want to have some sort of want to preserve a first mover advantage. I think this is a big plague of quote unquote open data in the biomedical community of like this steps of governance. Most of the time are much more complex than they need to be. And they really disincentivize people from outside the community, such as, for example, AI researchers to get access to the data. And they make it de facto be open in appearance only. So once again, sharing doesn't mean reuse. We know it very well when we talk about drug development. There's a famous moniker around the valley of death, which is that big gap between academia discoveries of a new target or a new mechanism of action, and then actually industry picking it up and making a drug out of that. And this really comes from the fact that research doesn't work like manufacture. The value chain is not driven by demand all the way back up to the source. In manufacture, you have someone that needs a tool, and therefore there's someone that's gonna buy parts from this tool, and people that build the parts will eventually go buy the raw material. And so, the demand propagates upstream all the way to the source. Research is not like that. Research is more like art. There's someone somewhere that solves an interesting problem, attacks a very interesting question, maybe just for the sake of it. And it's just paid for doing that. And they just absolutely only loves doing that. But maybe they do that, from a spirit perspective. They know that eventually it's going to help people, but they don't think about translation all the way. And on the other hand of the spectrum, there are people that are just building translation tool, they're building drugs, and they don't really know what are the big ideas that are being talked about in academia. So you kind of have that gap, and you really kind of have to have someone like, gallery curators you have in art, like people that bring together producers and consumer in a strategic and intentional way that you don't see in many other industry. And so for the last part of the talk, I wanted to talk about one potential channel of building or bringing together two communities that I think should be brought a lot more closer together. And those happen to be the two community which I belong to, the two hats I wear, like the AI in health community and the data producer scientific community. I think a fantastic way of bringing these two communities together, as at least for Sage, has been creating challenges. What are challenges? Challenges are open science events built around a range of biomedical topics where anyone can submit an idea for a challenge, and this challenge should be a benchmark. Should be, it's not a challenge, is a data set plus a machine learning task, plus a leaderboard. So for example, find the best way to fold protein, and there is a ground truth that is hitting from the participants, and everybody proposes their algorithm to predict the protein folding of a set of given protein, and the people that do the best win a prize. You can define that throughout for any biomedical research, and they are incredibly engaging. And at Sage, we've been running them for more than a decade and had more than 30,000 participants and written a lot of paper about methods that have beaten state of the art. They are a great way to advance the field on a specific task, and I really think it's the most effective way to generate reuse around a data set is to build a task and create a challenge around that. Just to give some idea of recent challenges that were run on stage, they could really run the gamut between segmenting brain glioblastoma brain tumors. Who does that the most accurately wins, obviously, to guess cardiovascular risk from health record, or understand if a recording of coughing is COVID or not COVID. Again, the sky is the limit. You just really need a well-curated data set and a question that you can turn into a machine learning task, and it can be solved automatically. And there you have a challenge. I'm sure you've heard of Kaggle competitions. What we've run at Sage and the subset of to the Dream community is just like an equivalent of Kaggle, but for biomedical research challenges. These challenges have, in some cases, a clear impact on translation. A great example is the digital mammography challenge, which was done in collaboration with Dream in 2017. Had $1 million cash prize. That's a really good motivator. And it was meant to develop better algorithm to detect breast cancer from mammographies. And we got word that 6 years later or 7 years later in 2023, just recently, 2 of the top 3 winners of the challenge got FDA approval for algorithm for detecting mammography, for detecting cancers for mammography that, we don't know for sure, but we like to think might have been catalyzed, might have been enabled by the challenge that we put together 6 or 7 years ago. Challenges are really also a fantastic educational tool. They are an equalizer. They are able to bring complex scientific question to anyone. And one great way to visualize this is to look at this, leaderboard for the CODA challenge, which again is a challenge that is meant to detect whether a recording of coughing is COVID or not COVID, where the third one of the top 3 team is a team of high school students. How amazing is that we can harness the ability, the best skills of anyone out there that's able to put a GPU to a good use and fine-tune transformers in that, regardless of their scientific background. And if you're great at that, but you're still in high school, you can win. You can win cash and you can advance science. So challenges are really API for connecting communities. There's one thing that I think is often overlooked, even if I look at myself, is that community of scientists and community of AI engineers are quite different when it comes to a lot of norms and the way we operate and the way we think about the world and the language that we use. And so having challenges, it's almost like an API. It abstracts all the scientific complexity and therefore enables anyone to focus on their best effort, which is machine learning. I'm going to just talk about one more slide and then conclude. I think that challenges are an incredible way to increase data reuse in the biomedical world, and more generally, benchmark are. a challenge is just a benchmark plus a leaderboard. It's a benchmark plus an engaging component that gets people to engage with the benchmark. But we've all seen in machine learning, in standard machine learning, the power of benchmarks such as ImageNet has been for computer vision that really has started, computer vision in that incredible hike in performance that has brought us to generative AI that we have today. And I really think that we need the same in biology. We need a few ImageNet moments, and I really hope that you can help me make some of those happen. Again, we're running challenges as Sage, but we also are corralling all biomedical challenges out there in this new effort called openchallenges.io. If you know of any biomedical challenge and you don't find it there, please drop me a line and we'll add it to the system. This is a way to centralize knowledge about cool biomedical challenges out there. With this, I conclude. And here you have my references. Drop me an email or Twitter or X or whatever it's called these days. I'll be happy to chat. Thank you again for inviting me.
Thank you, Luca. Thank you so much for sharing a bit about the importance of open data and how actually challenges can help that happen. I have one question about what struck me is that you said open data is not enough basically. If you don't properly curate, document the data, it is difficult to have what you call effective reuse. So what can we practically do to kind of like increase the chances that others can, properly document the data that they post? Is that an education problem in your opinion? Is that an incentive problem? What is that?
Yeah, I think there are two things to talk about. There's definitely, the curation and the quality, the perceived quality of data that is important. And as you say, there's no direct incentive for that to happen. Most of the time, maybe here a little bit of context is important. Most of the time, this data is curated by researchers that are paid for their research, not reusing the data. So even if the funder, in this particular case, NIH, has increasingly been strong on pushing for reuse, direct incentive for this curation piece, this like increase of quality that makes it available to other, is not quite there yet. I feel like that the thing to do there, it's kind of just like waiting at this point. The things are starting rolling in the right direction. The NIH is becoming more and more forceful, in a nudging way, in bringing people like us, for example, and bringing Sage as part of a grant in such a way that maybe the researcher themselves doesn't want to curate the data, but Sage can come in. I think there's a huge opportunity there for having a more community-driven incentive. And Ricardo, with ResearchHub, would explore some of this idea of like how can we create incentive for a third party to come annotate data that is not correctly annotated. But I think that is not going to solve the reuse problem by itself. As I was saying earlier, you really have to think strategically about distribution channel. Who are you hoping is going to reuse this data? Is this the AI community? Okay, you have to go talk to them because they don't live in the same space, in the same generation, in the same language than scientists do. They use Discord, right? They don't use emails. They are, they publish in NeurIPS. They don't publish at GA4GH. It's just like you have to actively seek out the community that you want to reuse, almost like in a marketing way, if you will. I think that is the bigger, that's what sets apart, Git from GitHub, right? Git is a tool for sharing code. It doesn't have a social component. GitHub tells you what is the code that's most reused and what's hot in the community right now and what it should be looking at. So we need to create like a GitHub equivalent for biomedical data to the community you want them to reuse to, so people can just like log in and know, oh, the hottest data set now these days is this and that, and I can just download it with a one click from Hugging Face and I'm done. I think that is the work that needs to be done to really create effective reuse.
Okay, so basically, involving all of the stakeholders, since the beginning, since the creation of the actual, project, the whole idea, starting to talk to people before you actually, create this data, so that what is the best way to produce and share the data.
I think so. I think one good rule of thumb is that thinking that build it and they'll come is not the right mantra here, right? Build it and they will not come. You can have the best data set out there, and unless you bring it intentionally to the community you want to reuse, it's not going to get out.
Yeah, absolutely. Absolutely agree. I also have a follow-up question that's kind of like more related to what I do. I also work with some type of data, work with biomarkers. And so something that always strikes me when I read, papers is that it's difficult to find reliable biomarkers because there's so many studies that highlight one potential biomarker and then you find other potential candidates. So there's many biomarkers that seem to be great candidates from, for detecting one disease, but very few of these have the statistical significance to that you can actually use them to, for example, develop a sensor to detect the biomarker. And then I realized that there are at the same time so many studies done in parallel where people analyze, blood, serum, saliva, urines, and so on. And if only there was a way to coordinate and use the same practices on how you collect these samples, analyze the samples, and kind of like increase the statistical significance, that would just like benefit everyone. And so you were talking about challenges. It would be amazing to have a challenge where you bring all of these research groups together to create more statistical power for science. Do you think this is more like, I don't know, maybe that's kind of like utopical, but like, do you think something like this will be, possible in the future where you can all collaborate to actually, make all of this research on biomarkers more effective?
It's so funny you mentioned this. Wasn't even, prepared, but I have the secret grand vision of, everything could be seen as a prediction task under some lens. So, a benchmark, as I was talking about earlier, which is again is a challenge without a leaderboard. A benchmark basically tests out people's algorithm against some sort of ground truth, right? Like your algorithm looks at an image, tries to guess if there's breast cancer there, and then compares behind the scene with the ground truth, is there cancer or not? And if it's right, it gets a score. If it's not, it gets a bad score. Biomarkers are fundamentally measures, and measures are exactly one way of predicting one quantity from another. So you can actually use the same exact process of building a benchmark on biomarkers to bring a community around and develop the best measures that, given some sort of input data, can predict some sort of outcome. I think there are some folks, at least in the digital medicine world, when these biomarkers are coming from digital data, so more like sensors and less so analyte, that are pushing for this. The Digital Medicine Society is really putting out a lot of guidance on how to build measures in a cohesive way, and don't go out and build your own measure by yourself, and because we're all going to do the same thing and poorly so. Let's join forces. Is one. Human First is a startup that is putting together an atlas of measurements and really try to embrace this idea of precision measures. But I don't know if there's as much of an effort more on the more bio and analyte world, but I think the same recipe that you would use to have to validate machine learning prediction algorithm, you can use to validate any sort of measures that try to link a quantity to another one. So absolutely, yes, let's build it together.
I mean, absolutely. We'll be talking a bit more about this because I'm just like, as I said, working on this, so I have a few ideas. So we'll be talking more about this for sure in the near future. With that said, Luca, again, it's been a great pleasure. Really enjoyed the conversation. And for anyone in the chat, if you have any any additional question to Luca, just drop in an email. Is more than responsive, and I'll get back to you. Thanks again, Luca.
Thank you for inviting me.
Okay, next up we have Jessica. I see Jessica, you're already in the chat. Hi, thank you for coming to SciCon.
Thanks so much for having me. It's great to be here.
Let me also bring Johnny on board. He's in the backstage. Oh, I should probably reclaim host before. Wait a second. Here we are. Jonathan?
Yes. Can you hear me?
Yeah, we can hear you.
Great.
So leave it up to you to introduce our guest.
Yeah, nice to meet you, Jessica. And let me introduce you to everyone, and then you can take it away and tell us what you have to tell us. So Jessica, she's the executive director of ASAP Bio. And I reached out to Dora to ask for some speakers, and they referred me to Jessica when I told them what we were doing. And I think they put the nail on the head. So Jessica is a PhD in biochemistry from the University of California, San Francisco. And she did her postdoctoral research in the Department of System Biology at Harvard Medical School. And she is in the steering committee of an organization called Rescuing Biomedical Research. And from there, she went on to become the executive director of ASAP Bio, which is an organization dedicated to accelerating biomedical science, which fits really well with our own mission at ResearchHub, where we also have as a motto to accelerate science. And so they referred me to her based on what we were doing. And Jessica told me she was going to talk about the problem of quality assessment. Once we have preprints out everywhere, then the question is, how do we ascertain what is high quality, what is low quality, and what can we trust? So Jessica, please take it away.
Thank you so much, Jonathan. I would love to share my screen. I think that participant screen sharing is disabled at the moment. But while we are maybe waiting for that to get worked out, let me just say that, I come from this background, I think like many people here today, of, thinking about the experience of being an early career researcher and kind of being affected by a lot of the incentives that I think are not necessarily perfectly well aligned with publishing research that is the most collaborative and maybe the most rigorous. I think that the career structure of the biomedical research workforce kind of is not necessarily at odds with the type of publishing that we really need if we're going to be tackling global challenges. And I think that, just a little bit of background about ASAP Bio, we're a small nonprofit organization that I helped to co-found after doing a postdoc and being, looking for ways to help this situation and maybe help align scientific publishing better with desires to be creative and collaborative and all those things. So I think that the origin of ASAP Bio really came in this study that our founder, Ron Vale, did, which was looking at how long it takes grad students to come out with their first paper. So in the 80s, this used to be like less than 5 years. But despite the fact that we now have like computers and the internet, in 30 years later, it was actually taking a year longer. So what is this? We now have instrumentation, we have the tools to make science go faster, and yet it's actually going slower. Why? I think that one component is that over this time period, the drive for publishing in high impact papers, publishing in high impact journals has kind of encouraged people to put more and more and more into a single paper, so that, in the 80s, these journals didn't even have supplemental figures, but even if you left those out, the number of panels inside those articles was several times smaller than it is today. So I think that, there's really a situation where there's a lot more data coming out, but people are holding on to it and trying to craft this really long narrative out of it. And again, it's because, of this quality control process that we have in place that is, I think right now, inhibiting the sharing of science. So how do we get around this? I mean, I think that right now we have this situation where publishing is really multiple different components all together. There is a dissemination angle, There's peer review and curation and prestige that all together are wrapped up in traditional journal publishing. So if you're going to play this game, you're going to try to make sure that you have the best and most convincing story possible before you actually disseminate your work. But I want to talk about a few different approaches to disrupting this bundling that enables people to actually share earlier. So micropublications, of course, just do the same thing, but with a smaller unit. Everyone agrees that it's going to be a smaller unit. I think that's definitely working. Pre-registration and registered reports. Let's actually perform peer review maybe on just the study design. I do think that that is also an incredibly effective tool that is dependent upon different experimental workflows in different disciplines. And then, of course, there's multiple people who are just putting stuff up online, kind of eschewing the entire article format altogether, building custom websites. And, there are definitely interesting experiments in this space, like eLife. But I want to highlight today models that focus on a publish then review approach, where first people can disseminate their work with preprints, and then journals, peer review services, and curation projects can come in and evaluate it. And I think that this is really going to be the future of publishing, where you have both the rapid dissemination as well as some kind of quality control, if you like. And I think that there's a lot of reasons why we need to evolve the peer review process. But hopefully we can talk a little bit about why I think there still needs to be some information, ways to filter information and give context to readers. So I think probably most people are aware of preprints, but they enable this kind of emergence of work out into the public during the time that it would otherwise be undergoing this review process that is hidden from the public view. And while articles are out on preprint servers, and here we've drawn this diagram to indicate that many people are just posting the manuscript that they'd submit to a journal. In fact, a lot of preprints can also be posted in advance of journal submission or separately from journal submission. There's no reason why a preprint needs to be submitted at the same time as a journal article, except that is sort of the convention. And it's a way that preprints have allowed to kind of come alongside the journal workflow in life sciences. So preprints are not reviewed by the server, right? And this is what enables them to be posted rapidly. And this is, I think, the key feature that enables us to think about whether there's going to be some kind of quality control or quality signaling. They're versions, so they can be easily updated or corrected, which I think is also impacting this entire notion of review and feedback, that the article is not static. It's something that is changing. It's compatible with journals, it can be citable, and really a lot of funders are now acknowledging preprints as evidence of productivity. But I would say that culturally, it's not necessarily seen as equivalent as a journal article. And that's because, again, people are looking to those journal titles as a way to provide a shorthand signifier for the quality of information. So there are over 600,000 life sciences preprints. Basically, bioRxiv launched in 2013. And so there's really been this sharp growth, especially during COVID, and now it's kind of plateauing, where we have a pretty steady rate of preprinting that has been supported by funder policies. So funders like the Simons Foundation, I believe the Simons Foundation was the first to really have a formal preprint policy that supported the use of preprints for demonstrating productivity for grant applications and reports. And this has been followed by lots of funders, both public and private, in the United States, as well as in Europe, and even in Latin America as well. So I would say also that I think something interesting here is that there are a number of different preprint servers in operation. So bioRxiv, I think, as well as PeerJ preprints were the first to launch in 2013. But now there's many more. And I think one thing that is really notable here is that a lot of these are actually commercial servers. And I'll get to that in just a minute. But we're able to generate this graph. This graph is actually from Europe PMC because preprints are now being indexed by Crossref. They're appearing on PubMed. And eLife has now, as you may know, launched this new publishing model that really centers on preprints and does away with accept reject decisions, but instead posts the reviews on preprints. So while this growth is impressive, I would say that we still have to keep in mind that in the life sciences, the volume of preprints being posted per month is about 10% of the volume of papers being posted to PubMed. So still, preprinting is a minority practice, even though it has grown a lot over the course of the last few years. And what I want to highlight here is that these preprint servers, some of which are owned by nonprofit entities like Cold Spring Harbor, the majority of these other preprint servers, and of course there's SIPS, which runs SciArchive, which is on the Open Science Framework. A lot of these other servers are actually owned or affiliated with commercial publishers. And I think that this is a really important thing to consider as we head into Open Access Week later this fall in the Northern Hemisphere. And I think that's something that we are at ASAP Bio are going to be running an event about. But the point being that if we want to think about how to remove control of scientific communication from a very gatekeeping and commercialized space, that I think we need to think about the governance of these community preprint servers and where people are putting their work. I will say that, like, for example, Research Square, on everything on there is actually CC BY. So I think that is a fantastic step in making sure that the content can be reused and fostering innovation. But as far as I think probably the theme of this conference on decentralization, right? I mean, I think that this picture is painting a very centralized image of how people are sharing data. But I think that one way that preprints are being shared in a less centralized way is through institutional repositories. So we did a survey with the Coalition of Open Access Repositories. And we found that most of the repositories who responded don't have very many preprints, but they're just in this sorted plot. There's a few that really have quite a few thousand preprints. And unfortunately, because the metadata is sort of unclear, we don't really know how many of these preprints have their only home on the institutional repository, or whether they're just an archived copy of something that appears on Archive or BioArchive or something like that. So I think that this is an example, though, of universities and libraries wanting to support their own researchers in sharing science in a way that doesn't rely necessarily on infrastructure or commercial entities. So that said, I think that the services that are actually offering preprinting, archiving, don't necessarily offer the same kind of technological supports as a preprint server per se. So these institutional repositories are, 60% of the time linking to the final version of the article. But a third of them are, for example, not doing that. Some are assigning DOIs, some are offering support for versioning, but in general, this is not something that is really offered to the same degree of standardization as it is in traditional preprint servers. Okay, so I'm going to skip that slide in the interest of time. But just to say that, I think that on this whole concept of moving science into a more decentralized place and removing barriers to sharing, I really think the preprints are exceptionally good at doing this. So there's this wonderful paper called Preprint Match that appeared earlier this year, which in which the authors used a tool to create linkages between preprints and final published articles. And what they found was that for countries that have a sort of high income countries, the preprints by those authors were getting converted into journal papers like 2/3 of the time. But in the low and middle income countries, a much smaller fraction of preprints go on to be published in journal articles. And I think that you could come up with a lot of like theories about why this is the case. Like, for example, a lot of people who are skeptical about preprints will say, you know, if a preprint hasn't been published in a journal, then why should I read it? Because it probably got rejected. But as an alternative, you know, explanation, publishing in a journal takes a lot of money in some cases. It takes money not only for the article processing charges or page charges, but also for reagents that are necessary to perform revisions. It takes time. It takes a stable group of researchers. If your grad student leaves, or if your postdoc leaves or something, how are you going to, or you maybe don't have a stable position as the PI, how are you going to finish that paper? And indeed, in this study, the papers reporting external funding were also more likely to be published in journal articles, in journals. But I think that, this points to this notion that all of these papers that are appearing as preprints, but not getting published as journal articles. One way of thinking about this is that this is science that is going to be hidden. And by actually enabling people to share it without this protracted publishing process, that's a way to get more research out there. And there's a variety of different papers now looking at comparing the data reported in preprints and the data reported in journal articles, and finding that there's not a huge amount of variation in for example, in these epidemiological estimate values reported in this study, and also not a strong correlation between the quality scores of preprints that go on to get published versus those that don't. So I am certain that peer review improves papers, and peer review has many other functions, including like sorting things into interest levels and highlighting what's going to be interesting to different audiences. But I think that all of this points to the fact that we need a more nuanced way of kind of evaluating papers and evaluating research. Okay, I'm just going to breeze through this in just a moment. I think that, getting back to this anxiety of preprints as things that are potentially sources of misinformation, because, they're not peer reviewed. Well, first, I have a few, thoughts about that. One being that clearly, unfortunately, our peer review process is not a bulletproof way to make something true. And that in fact, there may be a false sense of security for basically putting something through a peer review process and then assuming that one can simply trust that because it's been peer reviewed, it is correct. But nevertheless, there's no peer review happening on preprint servers. And this means that even things that are more obviously problematic, shall we say, will go through. So early in the pandemic, this paper appeared on bioRxiv, positing that there was some sort of similarity between HIV and SARS-CoV-2. But within just a couple hours, there was a huge response on Twitter and in the comment section, which bioRxiv does a very nice job of linking directly under the author list of the preprint. And this response from the community actually led several news outlets to pick up on the controversy and report on that, rather than picking up and reporting wholesale the paper itself. And within 48 hours of this paper being posted, the authors actually decided to withdraw it, which is an unthinkable turnaround time if one were to consider something appearing in a journal, waiting several weeks for the correspondences to come in, and back and forth. So yes, I think that preprints enable rapid sharing with fewer barriers, and that can create problems, but it also provides a way to more rapidly activate like this kind of immune system of the community. Now, I showed you a really dramatic edge case of how online community discussion can help correct misinformation. But I think what's happening much more frequently is simply that there are open commentaries on preprints that help readers and others understand the paper and help this kind of quality filtering. So bioRxiv is integrating with a bunch of different feedback providers. So for example, they have this little tab here where formalized peer reviews can appear. And I think what's interesting about preprints is that we have less of reviewers acting as a gatekeeper function because the paper is already out there. It's not as though they're guarding this publication, getting a sell paper, getting a scarce resource. Rather, it's more about providing context and providing help to the authors in improving their paper. So let me just go through here and say that, like, for example, there's a lovely demonstration from Dan Quintana, who posted a preprint that he wrote on a discussion group on Facebook and actually found a collaborator who became a co-author in this way. And I would say that because preprints really dispense with the need for peer review to fulfill this very specific function, we now have a huge variety of different experiments that are being in play here. From on top of this layer of preprint servers, there's all of these preprint feedback initiatives that I think are addressing this problem of quality and quality signaling as not at the level of what gets displayed on the preprint, but rather what are the readers going to see and how are the readers going to make sense of the paper. And then what's interesting is that these range from very minimalist to kind of like more journal-like. So for example, ELIFE's new process, there's no accept reject decision, but they still use a controlled vocabulary, which I should say is really novel to signal to readers the importance of the findings and how rigorous they seem to be. And there's also these other initiatives like Biophysics Collab, Review Commons, Peer Community In, that are essentially operating an editor organized peer review process on top of a preprint. But as we go down this like slide here, I think that there's a lot of other choices. So for example, Prelights is kind of really like a news and views type article written by an early career researcher highlighting a preprint that they find interesting. So there's all of these kind of your review and curation systems that are appearing on top of preprints, as well as tools to kind of identify them, sort them, and organize them. So, for example, Review Commons was launched together by ASAP Bio together with EMBO, and it offers on top of preprints a single round of review. And then the reviewers are instructed just to pay attention to the science, not any potential journal. And there's a group of originally 17, but now even further, affiliate journals who agree not to restart the peer review. They'll just take the peer review and then offer this like curation and prestige by way of accepting or rejecting or performing additional review on that paper. And Peer Community In, I think, does something even more extensive where they really go through this whole editorial process, but they enable journals to also publish the paper. So the preprint reviews are definitely growing over time, but I need to highlight that this is like still a tiny fraction of a percent of all the preprints out there, of all the papers out there. So really this territory that we're talking about is really, really new. And I think as it scales, these ways of measuring what is important, what passes some sort of bar, what is believable. We're going to see more and more demands for that. And is that going to be looking like filtering on like a rank? Will it look like accepting, I think there's a drive to move away from binary accept reject decisions, but when you have a scalar value for quality, where do you draw the line? And I think this comes up most pragmatically in questions about indexing. If you're going to look at PubMed, what are you going to include for when papers are, the editor is saying that the paper is flawed, for example? Do you want that to show up in your search results? I think that's an interesting question to provoke the discussion. But nevertheless, we're starting to see some formal recognition for preprint peer review, both by Plan S, which is this coalition of funders, especially in Europe, who are promoting open access, as well as in the context of recognizing early career researchers. We are kind of working and thinking about preprint review and how does one draw the line? Like, well, how do you say a paper has been reviewed? Where do you draw the line between just like a comment and a peer review? And so we've mulled over some of these questions there. But I want to also just end on the fact that the European Council in May made a call for no fee publishing, what they call no fee publishing model. The idea being that open access comes at a huge cost to researchers, whether that's through article processing charges or transformative agreements entered into by their libraries. And, I think what we need to make scholarly publishing really equitable is actually a model where the cost of publishing is borne directly by funders and institutions. And I think that preprints and these peer review layers can actually offer this and offer a more community-owned way of publishing research in the future. So with that, I want to say thank you to the organizers, and I'd be happy to answer any questions now or over email.
Well, thank you, Jessica. Very insightful talk. Thanks for sharing your knowledge. All the graphs really illustrate the point. Ties in really nicely into what we have been doing. Let me see. I don't see any questions from the audience. I took a couple of notes. Maybe I can also ask you about that. I think one interesting aspect thing that I would like to know about is when you were talking about the institutional repositories as like an alternative to decentralized ownership structure of preprint servers, because that is something that actually every university has, like not every, but like generally they have it. And then there's a way to access all these papers. The difficulty is kind of like the findability and the aggregating here. And there's this one interesting project, I think it's called Core, COAR Notify project, but I cannot try to interlink them. And this is something that to me makes a lot of sense, because when I was first starting to think about decentralizing science, I thought the ideal way would be if the universities would be the nodes in the network that actually make sure that the record is maintained, right? Like in a blockchain, you have nodes, and then they would work like this. So every institutional repository should be or could be that. Can you maybe talk a little bit about this Notify project? Do you know more about it than I do, maybe, and can explain how that could enable such a decentralized way of maintaining the literature, and then also the links and the quality assessment between different papers?
Yeah, absolutely. So the Notify project is, as you mentioned, supported by the Coalition of Open Access Repositories. And the idea is really just that every single repository or peer review service is able to send notifications to one another saying, I have a paper here for review. I'm going to review your paper. I've completed the review, without any single centralized way of transmitting that information. In other words, that it's transmitted directly from a repository to preprint service, preprint review service, and back and forth. I think that's a really interesting and exciting idea that I believe actually has a kind of really solid foundation in this idea of autonomy and the fact that you don't necessarily want to rely on, for example, an entity that is minting DOIs and charging large fees for that. But on the other hand, having this distributed approach can make it more difficult to create the kind of index of all of the that a researcher might want to just browse a single catalog. So I think that there's pros and cons, and we're going to have a workshop together with Europe PMC in October to talk about these different ways of transferring metadata around reviews and preprints. But Core Notify is really an exciting project that is going to be represented in that conversation. Thank you.
Maybe if I can respond to that and add a little bit to the question. Thank you for enlightening it a little bit. It brings back to mind a conversation that I once had with them about it seems to be like they're sort of like the internet of research papers in a sense, and trying to connect them together. So that would mean that you have to upload to your own institutional repository, for example, the review, to then be able to link those. But what I see here as like a challenge seems to be the UX, because I had to upload my thesis into that thing too, and it was not great. It's not how I want to interact on a not in the most natural way. I would open Twitter to make a comment, and then that's even not ideal. So is there a way for this to work out and to collaborate in a sense where we can improve the UX of this feature so that we could actually benefit from it in a quicker way? Because oftentimes that for the diffusion of innovation, that is what really drives the actual innovation, right? Is that
and right. And I also think that the kind of idea of actually relying on universities are wonderful, but I also feel like there's scholars who are unaffiliated or scholars who don't have the same resources as those who might have a university who can create a beautiful institutional repository for them. But nevertheless, I do think that there are more tools now that can provide more of a distributed network. So for example, Ludo Waltman, who I know was speaking earlier in this conference, uses PubPub to write reviews. And that is something where that's a really very modern tool that is designed to be able to reference work elsewhere. So I do agree that UX is incredibly important. And I would say that even the motivation for scholarly publishing is so much driven by career needs and prestige that I feel like even the most profit-minded commercial publishers are not really nailing this UX thing. So I think there's really a lot of opportunity for innovation in that space.
Yeah, thank you very much.
I have another question, if I can. It's kind of tangential, but I'm pretty sure that you can give a pretty good insight into this. I want to talk about open peer review, the concept of open peer review. So we've been experimenting a bit with kind of peer review on ResearchHub. So we're trying to get people to basically upload preprints and do peer review, and trying to reward them to do so. And something that we've been finding a challenge is balancing the openness of I want to do an open peer review, so have people see who I am, see my skills, my expertise, so they can trust what I say. But at the same time, if my name is up there and have to do a peer review of a prestigious scientist, there's also that I could be afraid of saying something that might backlash to me. And so there's probably there's not a clear answer. Where do you think is the balance in between this openness, but also preserving your own status, I would say?
Yeah, it's such a tricky issue. I think that, a lot of people, there's a couple really interesting, I think first of all, it's possible to be open with the content of the peer review without necessarily signing it. And I think that is something that is probably more universally more comfortable for a lot of people. I definitely feel that, people, there's a lot of concerns both ways that if you sign your review, you're going to be open to retribution, but also there's this concern like, if people have to sign their reviews, then they're going to pull their punches because they don't want to actually be too offensive or something like that. So, I mean, I think that there's it's an incredibly important topic. I would love to be able to say like everybody should just sign their reviews because you'll get credit for it. But frankly, the credit, there's no real formalized credit for peer review anyway, which I feel like its own separate problem. I do think that I want to highlight that pre-review, the service pre-review has a really nice solution to this, which is that they offer you the ability to post a review under a pseudonym. And then at some point in the future, when you feel more comfortable, perhaps in your career or some time has passed, whatever, you can then flip your pseudonym to actually display your own name and your own ORCID ID. And so I think that's a really nice way of saying like, here's an identity. I'm not going to tie it to myself, but it is there and I can claim it at some point in the future.
Is there a way for someone else to see that pseudonym have like a kind of like a specific expertise? So I can see that you that have that specific expertise wrote that peer review. So I can kind of like, I know that the content of the peer review should be self-standing, but if I see that you have done this kind of work in that specific domain, I might understand why you're telling me specific things or not. So is there a way for that?
I don't know that pre-review has implemented that. I mean, I could imagine that if with some sort of like, authentication from maybe a person verifying certain things. I feel like that could be an interesting feature to play around with, but I don't believe that pre-review is doing that at this time.
Yeah, that's a clever solution because you kind of want to build your reputation over time. And then when you can kind of like unlock it and let people see, hey, it was actually me. So yeah, definitely.
Yeah.
Thank you.
Yeah. Thanks.
Thank you, Jessica. Right. So next up, we will have Eric van Winkel. I already see him in the audience. Ricardo, if you would bring him on. So yeah, meanwhile, I will, there he is already. Hello, Eric. Not sure, can you, no. Can you hear me, Eric?
Eric, I think you're muted if you're trying to speak and your camera is blacked out.
So while Eric is figuring out his settings, I suppose, I will go ahead and introduce him. I was asked by Jelani to take this on, so I'm not fully the expert on Eric's background, but I will give it a shot, and then maybe Eric can correct me if I didn't fully do him justice. So Eric van Winkel is the head of operations and community at DeSci Labs. And he has previously been involved in Constitution DAO as a core member. Those of you who remember, Constitution DAO was a DAO that was trying to buy the American Constitution. I met Eric one time in Amsterdam when he was part of the organizing team for DeSci Amsterdam, where I think they did a great job. It was an amazing event where I met a lot of the interesting people that I'm still connected to in the DeSci space. And today, Eric is going to talk about Onchain publishing and credential to get connected to the work that they have been doing at DeSci Labs. So,
yeah, absolutely. Thank you, Jonathan. More than happy to. So just a heads up, I'm having some Zoom issues with my laptop at the moment. So I'm going to be trying to finish some of those in the background, where hopefully by the time I make it to a point where I need slides, I can be back on. But in the meantime, I'm actually just going to quickly talk through some of the context and overview, and maybe give a little bit of an overview on myself as well. So
Eric,
to start with,
sorry to stop you. If you want to try to send me the slides, if that doesn't work, want to send me the slides, I can try to project them on the screen for you, if that helps.
yeah, that would be awesome. That's probably a better way to go about it. So thank you.
Can you open your camera?
I'm on my phone at the moment, but let me leave. Somehow it just came up on my laptop. Well, no, that's probably for the best. I will put my camera on. If you can give me just a second, and sorry about this. Let's see how this works.
Yeah, nice. I can see you now. That feels much more. Now it feels much more like a conversation.
Alrighty. Well, in the meantime, you'll have to excuse as I'm not looking at the camera itself, because I am exporting all of these files and sending them to Ricardo. But my name is Eric Van Winkle. I run operations for DeSci Labs. For those of you who may not have met us, DeSci Labs is a group that's working on the creation of PID infrastructure for research objects. So one of the things that we are incredibly passionate about is the idea that the scientific record itself is the center of human knowledge, and that the entirety of the scientific process should be captured within the scientific record. So at the moment, the only thing that you typically see in any kind of a publication is going to be the final manuscript, the PDF. If you're lucky, you'll see code and data. Although I will say that one tends to be more available on request than anything else. If you're incredibly lucky, you're going to see methods for a biological paper. You're going to see code that's been structured to be reproducible. There are ways that we can make the scientific record into a more complete and thorough representation of the scientific process itself. But we have a ways to go before we can actually make it there. And that is the focus of DeSci Labs. So we want to create a scientific record comprised of open and reproducible research. We want to make sure that any and everything which we create is done through open source software and is created as a part of open protocols. We want to make sure that interoperability and the FAIR principles are one of the basis of any of these creations, so that we're thinking about the future of machine actionable science as opposed to just the current paradigm of human-centric science. And then finally, we want to use some of the tooling that we've created to make scalable meta science infrastructure so that we can continue to experiment on the scientific record and the scientific process, or the scientific method, I suppose. So with that, Ricardo, I just got that email off. One other thing that I'd like to point out before I really get started is the DeSci Foundation is a nonprofit arm of DeSci Labs. Actually, I believe they might be separate companies that hosts a series of seminars on a regular basis. We've had some great speakers. So the president of the Wolfram Institute came on at one point and gave a wonderful talk on cyborg scientists. We had George Church come on at one point, I believe. Great event. And for anyone who's curious, please, by all means, feel free to take a look into it. You can find more information at DeSciFoundation.org. But that being said, I'll get into, I'm going to go through three main sections in my presentation. The first one being context and background. So giving a little bit more of an understanding, which it seems like quite a few folks have already done throughout this larger talking or seminar series or event, but giving a broader overview of some of the exact problems in publishing itself. From there, I'll talk about how science is changing at a very high level and what needs to be done to actually look towards a solution. Then past that, I'll talk about the technology that DeSci Labs has made and some of the foundational components that we work on and why those matter and why they have benefits to individuals. And then I'll close out by talking about credentials on chain, because that's one of the more interesting aspects of blockchain, and that is actually the topic of this presentation. So I'll go through how we view pluralism, attestation, badging, and high-level credentials, both for organizations and for individuals. So with that being said, Ricardo, were the slides able to come through?
Yes, I have the slides, so I'll be sharing my screen. Hopefully you can all see it.
We can, and thank you for the audible here. So if we can start out with slide 2. Perfect, thank you. Actually, let's move to slide 3 if you don't mind. 4, because 3 is context and background. There we go. So the scientific record is the center of human knowledge. It is the point where everything is organized. It is the point where science itself can be referenced. And unfortunately, scientific publishing, the stewards of this particular record, have a series of broken processes and incentives that lead to a wide variety of problems. There are bad incentives on the scientific record, which incentivize novelty and to a certain extent sensationalism over robust, rigorous knowledge creation, which all stems from the impact factor itself. The unit of knowledge is obsolete. Large portions of infrastructure for scientific research were created in the early 1990s and haven't necessarily been updated since then. As such, the current journal and publishing system really only has a method of publishing solitary PDFs. There are a series of under-recognized efforts where you see a wide variety of people participating in the scientific enterprise, those who make data, those who make code, those who actually work behind the scenes to make to make research itself function smoothly, who just don't necessarily get recognized. If you're a researcher who has created an incredible data set, you can't accrue citations off of that, or it's significantly more difficult to do than accruing it off of a milestone paper itself. There are problems with fragmentation and link rot, loss of data, code, and artifacts, where if you're going to actually look for that information, it's a good chance that you're not going to be able to find some of the supplementary artifacts, which are crucial in reproducibility. We see the replication crisis. The president of Stanford University recently stepped down due to allegations coming from inside of the university about some of the methods for his research itself. And while that's still under investigation, that's just one of a million stories that continuously come out. And then finally, problematic business models. I know that this is one that Jessica just touched on, so I won't go too far into it, but scientific publishing itself is broken. If we can go to the next slide, Ricardo. The current infrastructure of science functions as follows. You start off by minting a PID, creating metadata in Dublin Core that would be stored with Crossref or DataCite, where that information and the PDF associated go into a data silo structured around JAST XML, and finally into the landing page for a journal itself. This is a series of problems in a lot of ways because persistence for this infrastructure relies very heavily on social contracts. Once again, technology from the early 1990s that isn't structured for the internet of the 2020s and the 2030s. As you have the landing page, one great example would be the landing pages for journals and the fact that they don't necessarily resolve to the actual content that's being requested. So if you're a researcher and you want to go and see a PDF, you have to navigate to the journal's landing page, find the PDF, open that, and then find the information that you want. And as a human, that's not necessarily terrible, but as we look at some of the advances in artificial intelligence, we can start to see that humans and machines are going to have to work together to expedite scientific progress into the future. That's going to be the most efficient way to move forward. And thus, we need information to be organized in a way where that can happen. Ricardo, if we can go to the next. So fortunately, though, we do have infrastructure that's old. We do have incentives that are wrong, but we have a rare moment in time right now whenever change actually can happen. So the diagram that you're looking at is the Center for Open Science's theory of change. And it basically says that we need change to occur along all 5 different levels of what they view the scientific enterprise as. So starting at policy, then going to incentives, communities, UI, UX, and finally infrastructure itself. And for us to see change, we need both top-down change and bottom-up change happening simultaneously. And we've actually gotten quite a bit of top-down policy that's been coming out. The Nelson Memo rocked the world of academic publishing, in the middle of last year by saying information needs to be open upon publication and data needs to be published with code itself. And actually targeting funding agencies as opposed to targeting individual researchers is a very interesting way to go about that. We've seen the FAIR principles take hold in a big way over in Europe, especially with the formation of the European Open Science Cloud and some of the FAIR for EOSC initiatives that have been there. They really help to put a focus on the importance of data publishing and open access. Ricardo? We also see bottom-up movement, where it's not just policy itself, but it's a look at infrastructure. It's a look at UI, UX, communities, and incentives. I mean, especially within the DeSci community, we see so many of these different things being worked on a regular basis. People are developing apps to try and target problems in meta science. Communities are springing up with the idea that there are problems and that experimentation is needed to fix them. And all the way from policymakers down to grad students, you're seeing incentives, an understanding that incentives need to change to continue making science better. So with that being said, a rare point in time where change actually can be made. And that's something that makes me very optimistic about the future of research, about the replication crisis, about link rot and content drift, some of the problems that are out there. Ricardo? Thank you. So circling back to one of the things I was talking about just a second ago, science itself is a lot more than just a PDF. There's code, there's data, videos, presentations, supplementary artifacts. If we really want to go into it, there's sense-making data. And that's a very interesting question, as I think it was one that Jessica mentioned earlier. Where do you draw the line between commentary and peer review? But part of the answer is probably that you need both of them attached to the scientific record itself. So in one of the previous slides, I mentioned the fact that the current unit of knowledge is a solitary PDF. That unit of knowledge needs to change. And we at DeSci Labs see that as a research object. Ricardo? There are a wide variety of research objects actually being created in the wild. One of the more prominent places that you see this is in the personal websites of individual researchers, where they will post the preprints from their work itself. They will post different iterations of the actual papers. They will go in and post code, explainers, they'll post data sets themselves and store them in servers underneath their desks, because the infrastructure that is provided to them by the scientific enterprise is insufficient to actually handle a lot of that information. Then we also see community developments, platforms like OSF, like ResearchHub, like Hugging Face, which have had a massive impact on how we perform science, but have yet to be integrated. Then we also see changes popping up in the wild around the way that we validate and curate information with an understanding that peer review itself has problems. One of the more prominent versions of this curation and validation is attestations and badges, which you can see them in the ACM. I believe the OSF has them as well. eLife has been playing around with them. But the idea is that for smaller aspects of what's needed from a research artifact, you can put a true false statement on that. You can say, is the data for this paper open? True false. Yes. Is the data for this paper available? True false. Yes. Does this paper have high quality metadata? True false. Yes. I understand that high quality is a little bit of a triggering statement there. We'll get to that later on. But the important thing is that you see a need for change from a wide base of users who are looking to make improvements of their own accord. Ricardo? We can move from the static PDF to integrated publications where code and data work seamlessly together to show what the scientific record can be. We can move past some of the proprietary silos of publishers. We can move into a world where machines are equal citizens on the scientific record, where they can more efficiently help us build what needs to be built. And we can create a series of verifiable attestations that can make searching and crawling for quality information significantly easier. So with that being said, that's the context and the background. I'll quickly jump into the technology overview on the next slide. If we can go one after. Thank you, thank you. So DeSci makes two things, or DeSci Labs makes two things. We make an application and we make protocols. So the application layer itself is what we call a research object or a DeSci node. The idea behind DeSci nodes is that we can create an integrated authoring environment, which allows dynamic contributions. It allows for version histories. It allows for the Git primitive to be applied to scientific knowledge and scientific artifacts. We can create interfaces where peer review and reproducibility checks can be built straight into the PDF itself. We can put more of a granular focus on how reproducibility functions with respect to a paper, and actually storing outputs through a Jupyter notebook, which on the same window as the PDF can be viewed. Our goal is to do this without taking a researcher out of the original environment that they're used to, which is the PDF. A lot of benefits to the PDF. So from there, that application layer is supported by the next slide, which is the data layer. For the data layer, and I'll go through this one a little bit more in depth. The DPID protocol is the center of the work that DeSci Labs does. We believe that an upgrade to DOI infrastructure is going to be critical for science over the next decade to be able to account for the explosion of data, of artifacts, of supplementary information, of sense making, because you need infrastructure that can handle that explosion. So we start off at the bottom in the gray box by anchoring a root hash on-chain through the DPID registry. On-chain at this moment means optimism through Ethereum, but we're looking to expand that past any single one, L1 or L2, to make it multi-chain so that the entirety of the Web3 world can help secure the PID infrastructure of science. From that DPID registry, whenever a user navigates to the URL that's pinned on-chain, what that takes them to is the metadata manifest file for a specific node. That manifest file, both human and machine readable, go into that in just a little bit, takes someone to the root DAG folder, which can then let them expand to any of the subfolders and files within a research object. Not only is this secure and decentralized, but it's dynamic and versionable. We can have versionability and immutability in the same place thanks to blockchain. And I get asked the question quite a bit, why blockchain? Why does it have to be blockchain? This would be the answer. It's because we can square a famous computer science problem. We can solve it. It's squaring Zuko's triangle. Beyond that, we can allow programmable permissions on the scientific record, where even across version histories, we can let individuals be admins, but additionally, let them choose what's seen and what's not seen, who has access to the encrypted data, which, let's say it's a part of intellectual property. There should be specific people who have it and specific people who don't, but for their place as a researcher, they still need for their work to be seen as reproducible. Could be a great example of why that's useful. But just to reiterate, the DPID protocol is the center of kind of what we're building at DeSci Labs. Then to the next slide, there are a couple other aspects of the tech stack which are interesting and worth noting. The DPID layer is the one that I just went over. Would also love to give a shout out to BioDAO. It's a group that does orchestration for edge computing. So I think it's the opinion of DeSci Labs that data can be viewed as the most important artifact type on the scientific record. Data storage is cheap. Data storage increases exponentially. Moving data is expensive. And the world's networking infrastructure has not kept pace with the growth of the world's data generation and storage. Edge computing as a part of data reuse for scientific work is going to be very important. And BioDAO is an interesting project that I would encourage you to look into that helps organize compute requests through a variety of different ways. Then below that, for the data and networking layer, we use IPFS as a way to eliminate link rot, eliminate content drift, there we go, and mitigate the effects of link rot. It also allows for some of the versionability that we have and ties into blockchain very nicely as a part of a larger Web3 stack. And for the next slide, all of this technology comes together to give some interesting potential capabilities for any given researcher. So first off, a DPID is an API. So someone can come in, use the DPID, let's say DPID \42, to immediately resolve to the data that's there over HTTP. They can also immediately resolve to the metadata that's there through the API. So if you'll see on the second orange line in the first box, dpid.org \42 JSON LD. That attribute tells the API to surface the metadata for this specific research object. We actually surface it in both JSON and JSON LD for anyone who's curious. But as you see data publishing becoming more prevalent, the importance of metadata is additionally going to become more prevalent. And the importance of search engine optimization on metadata going to be a huge way that people work towards citations, impact, and metrics. So having metadata that can be easily surfaced in a standardized manner, very important part of any publishing protocol, and we believe that the PID is the right place to do that. Our PIDs serve as addresses for edge compute. So at this moment, it's CIDs off of the IPFS network, but we're working to make sure that through BioDAO, someone can send a compute job directly to a PID. PIDs as APIs allow information to be importable. So we made a Python library called DeSci-Fetch, where someone can query data directly from the scientific record into their IDE. So imagine if you could say from DOI.123, import data, and it just immediately showed up in Python formatted as a pandas data frame. That's exactly what DeSci-Fetch does. And it also allows you to import functions. Anything that's queryable through that API can be imported. And then finally, as a target for attestations. And I think this is probably, I'll go into attestations in the next section. So what I want to really emphasize is that these DeSci nodes and the DPID protocol allows for interoperability, persistence without social contracts, convenience for users, better user interfaces, and pluralistic governance of the scientific record. So for slide 17, the last thing that I want to talk about as a part of this presentation is credentials, because that's one of the things that's immediately coming up on our roadmap. So we take the stance within Web3 that pluralism is a very interesting way to go about identifying individuals. Attestations are something that we've been a fan of for quite a while. So the idea that you can have one of these small true, false binary statements around a specific research object. So you can say, yes, this research object has open data, or yes, this research object is reproducible. Now, yes, this research object has open data. That might be a little bit more cut and dry. Yes, this research object is reproducible. Well, that depends. Depends on what your hardware looks like, for example. I might be able to reproduce code created in Python 2 if I have an AMD processor, but I can't do it on an ARM. I can't remember if I got that switched up, but the point remains. It's important to realize that some of this is subjective person by person. So while one group, let's say ResearchHub, is able to reproduce it because they ran it on an older machine as it's an older piece of software, let's say another group, one of the PCCs, was not able to reproduce it and marked it as no. Then all of a sudden it becomes a question for the user of, do they believe that this is reproducible? What comments are in place to showcase the fact that this is reproducible? One of the interesting things about the DPID protocol is the fact that it is open. So if ResearchHub were to want to take comments from their platform as a portion of sense-making data on a paper, take a discussion around how someone reproduced a specific piece of work and add that straight to the DPID with all of the benefits listed above, that would be possible. It allows for all of this information to be portable across platforms, which is huge. We believe that this idea of plural sense making is the right way to move forward without, I guess, putting a single source of truth or a series of gatekeepers in place. Ultimately, it's up to the user to figure out what makes sense for them and to continue contributing to the larger dialogue. Then in the next slide, we see, my battery is dying. That is not what you want. In the next slide, we see the idea of Ricardo. There you go. In the next slide, we see the idea of decentralized societies. So one of the things we're working towards is the idea that any given research institution or, I guess, decentralized curation community can have their own DPID prefix that they own and control and host of their own accord and can publish versionable, persistent, and immutable research objects directly from that. We want to make sure that the proper branding is in place, that identity and access management is handled correctly. And we're building a product in the not too distant future called Gateways, which is focused on exactly that. And at this phase, it's something that we're still ideating around and that we would love help from the larger community trying to figure out. What is the right flow for attestations? What are the needs of a community as they work to curate this information? I mean, all of these are things that we would just appreciate the chance to discuss further. So if anyone's interested, please feel free to reach out to me about that. And with that, I'll go ahead and say thank you and open it up for questions. Give a big shout out to Ricardo for being on top of it with the slides. Thank you for that. And yeah, I'm excited to hear what y'all think.
Thank you, Eric. Wonderful talk. Making it fit in with the technical difficulties. Well done.
You do what you got to do.
So I have a quick question, if I can.
Sure.
So this year, when we were thinking about SciCon this year, Something that we really wanted to do is, and we tried to do, I don't know if we achieved it, but we definitely tried. We wanted to, again, bring together TradSci and DSci, and we wanted to show, how DSci is helping, fixing the problems of science. And so something that is really close to me is like, how can we show to traditional scientists that these things actually work? What are some of your experiences? Like, have you tried to speak, to TradSci people? How did you speak to them? What are some of the success stories of DSci labs in trying to implement nodes into like something that has been, currently used to publish? Like, just like tell me what was the experience of like talking to, scientists and researchers?
Absolutely. So I'll start off with two just kind of general statements. First off, a lot of researchers realize that there are problems in the current system. I think peer review would be a great example. People understand that it is political, that it doesn't necessarily always surface the best research, but I think another thing to point out is that scientists by nature are trained to ask why, to break things and to try and put them back together. So we've actually had a lot of success by talking about the problems and by listening to the solutions of individual researchers. So I think I just finished with this particular project about 3 weeks ago. There was a researcher out of Colombia who worked in fluid dynamics at the intersection of fluids and environmental engineering. And he had created a 0.5 petabyte of data, which was essentially a cubic centimeter scale wind turbulence across simulated versions of New York City. Tens of millions of hours on the Stampede 2 supercomputer, maxing out his lab's internal JBOD, all for one single paper. We talked to him and we said, hey, might be cool if we could share this, might be cool if we could do something with it. And over the course of a week or two, about 3 or 4, we figured out, yes, there are different ways that we can share this data. First off, we can get the synthesized version of it. So taking it from that 0.5 petabyte down to 0.5 terabyte and actually posting that through DSci nodes. Then in addition to that, we'll find the most important dimension for your research. And we'll work to help you get that stored in a way that works for your lab. I think that's a huge success. Then another just final closing point is that I think a lot of folks in the publishing industry specifically and the funding agencies are seeing some of the policy statements coming down the pipeline and understand that something is going to have to change and kind of see a need to innovate. So that's been another interesting angle to kind of work towards. But with all that being said, does that answer the question?
Yeah, absolutely. And I'm happy to see, to hear that you had a success story already. I know how difficult it is to try and transmit all of this passion and this technological breakthroughs to the traditional science world. So just really happy that you have a success story already, and looking forward actually to learn more about this, because I'm really curious about this particular story. But in general, I mean, amazing job. Big fan of nodes. So hopefully we hear many more success stories in the future.
Absolutely. I'll tell you, the one thing I think I might be the most excited about for that particular node, we got in early enough with this particular researcher that started off with the original preprint that got sent to the journal. At that point, he had 0.25 petabyte of data. And then it went through peer review, and the folks doing the peer review said, actually, can you double the amount that you have and rewrite the paper? We're going to get that second version as well. And then the final manuscript is going to be published open access on a very permissible license. So we may be able to see from version 1 to version 2 to version 3, the growth of not only the manuscript, but the code underpinning that research itself. I think that's going to be a wonderful example of a dynamic research object and a piece of knowledge growing over time. So it'll be exciting. I'll definitely make sure to follow up with you on that, Ricardo.
Yeah, definitely. I mean, that's exactly how, open source or like software works, versioning and so on, kind of like,
Yeah.
So yeah, definitely exciting.
Well, I think we can close it here. Thank you very much, Eric. As I said, well done. I'll head off and hand it over to Ricardo.
Thank you, Eric. Thank you again for coming. Yeah, so I think that's it. This closes day 2. This SciCon is not over, so remember that we're still missing a section, a quite important section of the event. We're gonna meet again on Friday at 3 p.m. PST for a fireside chat with the co-founder of ResearchHub, Brian Armstrong. What I can say, not gonna make it too sentimental. I'm an engineer by training, so I can just say that, organizing SciCon last year has been amazing, really stressful at the beginning, but then we learned a lot of stuff. We had a lot of amazing guests. This year we did it again. So many more amazing guests coming in, 4 panels that we didn't have last year, and just an incredible amount of positive emotions. And I would like to thank, first of all of the speakers that decided to come to SciCon, because I know it's virtual, but at the same time, it's a weekend. So that's time that you probably have, spent for something else you decided to dedicate to our mission to come up here and share your vision, your passion for open science, decentralized science, whatever that is. So really appreciated that. Appreciated the openness and like talking to the other panelists. That's been like really a pleasure to see. And I would also like to thank obviously, Patrick and the ResearchHub team for, giving us this opportunity to put up this event, which has been just like a big pleasure. Obviously, it's been, we had to do stuff to put this up, but it's been fun and we had a great fun. So hopefully you also enjoyed the event. I would like to give one last thank you, a big thank you to all of the people that are working behind the scenes. Sometimes there's only a few people that you see on screen. So maybe, that's me, that's Jeff, that's, Johnny that came up on stage and moderated a lot of the talks this year. But there's a lot of other people behind, in the back, behind the scenes that are making this possible, creating content, helping us with marketing, social media, content creation, and then, so many more things. So a big shout out to anyone who was involved in organizing this amazing event, which was once again virtual. Maybe this year will be not, maybe we'll still be virtual. We don't know. We have to wait until next year to learn more about that. And yeah, with that said, another big thank goes to Jelani and Deezer World that decided to, wanted to moderate some of the talks today and join us for SciCon 2023. With that said, I want to thank you again all for coming, and I'm gonna wait for you all on Friday to join us for our last event of SciCon 2023. Goodbye.